Good morning, everybody. Welcome to the September 28th, 2021 meeting of the Calvert County Board of Commissioners. At this time, I'd like to ask Bishop William Patton from the Calvert Lighthouse Church to come forth and give us an invocation, please.
Good morning.
Morning.
Good morning, everyone. Good morning, everyone.
Morning.
I'd ask you, if you would, to bow your head with me and join us as we pray. Dear wise and loving Father, we want to first say thank you on behalf of all who are gathered here today. Thank you for your many, many blessings. Thank you for life itself and the measure of health that we enjoy. God, we thank you, and we're asking you that as you have established this board of county commissioners to promote peace, order, and justice, and we're praying for them, Lord, and the various officials that are assembled here today. I ask, God, that you would grant them wisdom to govern in the midst of all of these conflicting interests and issues of our times. Give them a sense of welfare and true needs of our people. Give them a keen thirst for justice and righteousness. Give them a confidence in doing what is good and fitting, the ability to work together in harmony, even when there is honest disagreement. Lord, we ask that you would give personal peace in their lives and joy in their task. I also pray for the agenda that is set forth before them today. Give an assurance of what would please you and what would benefit those who live and work in Calvert County. In your name, amen.
Amen.
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So thank you, Bishop Patton.
Thank you.
So next, can we have a motion to approve the agenda or make additions or corrections?
Yes, sir, Mr. President. I move that we approve and adopt an amended agenda, moving the Assistance to Firefighters grant from new business to a public hearing, remove the executive session item, and also remove the committee nominations and compensation review board appointments from the agenda.
Second.
So I have a motion and a second that we amend the agenda for those two items. Is there any discussion on that motion? Hearing none, all those in favor say aye.
Aye.
Opposed? Motion carries. Next, public service announcements. We have with us today Mr. Larry Titus from the Calvert County Fair Board. Calvert County Fair starts this Wednesday. Mr. Titus.
Too many Larrys. That's
My other brother Larry.
I was getting, there you go.
I thought I'd been
Bob
replaced.
Newhart Show.
Never. Good morning, Commissioner.
Morning.
Morning.
Good morning. It's always a pleasure to come for such a good thing. I don't know what else you have on your agenda, but this is a good thing. It's always a pleasure to come before this distinguished board. And first, thank you. Thank you for all of your years of support that you've given the Calvert County Fair on the behalf of our board of directors, associates, volunteers, and all those people that make that possible. We really, really thank you for your support. But we are ready to kick off the 134th version of the Calvert County Fair. We believe we've put together some entertainment. We believe we have put together some a decent carnival and some food. Regardless of what your diet is, we should have something that you should be able to take part in. We've taken certain safety precautions this year given the pandemic that we did not have before. Mask is optional when you're outdoors, but when you're riding the buses for shuttle, we're asking folks to wear masks as the governor has suggested. We did make a little mistake this year as when we kicked out our fair booklet. There is a mistake in the admission for Thursday. Thursday and Wednesday somehow got replicated in the book, but we sent out a retraction. We don't think there'll be any confusion with that. But we believe that we've done an admirable job with your support and the support of the Calvert County Sheriff's Office and all the other agencies that help make the county fair possible. What I'd like to do this morning is invite you as a board to come in and take a look at what it is that we have. We have some season passes for you, each of you. We have a booklet for you that you can kind of peruse so you can figure out what day might be best for you, what entertainment you might enjoy. But if you can, come the entire week. If nothing else, you're going to get a lot of food. We got some new food vendors down there. We got some new exhibitors there. We got some new entertainment. I think you really will enjoy it. With that, do you have any questions, anything that I can ask you? Commissioner Weems.
Will H&H be there this year?
I have to check my list.
All right, sir.
Absolutely. There's no way we could do this without H&H pit beef and H&H funnel cakes. There's no way we could do it. So,
Could you please confirm that there will be corn dogs available?
I will confirm, yes, we will have corn dogs available.
Thank you. I'll see you there.
Absolutely one for you, Commissioner.
And for the record, H&H Funnel Cakes is the longest serving vendor at the fair.
Really?
That's correct. That is correct.
Since Mr. Marshall retired this year, that makes us the longest serving vendor there.
That is
We were at the old fairgrounds.
That is correct.
Yes.
Do you
But
want me
I
just to-
heard you retired too.
I retired. It's H&H, but it's my son now, not myself.
Funnel
Not
cakes
just
are hard
H.
on the back.
No, it's still H&H.
So what I'll do is I'll hand these over to you, Mr. Willis, so we won't have
So,
won't violate any social distancing.
Yes, sir.
Mr.
Anything else I can, but again, just thank you. Just wholeheartedly, we thank you. We could not do this without you. We sure enough want to welcome the citizens of Calvert County, in and around Calvert County, those who from other counties as well, to come and enjoy themselves. We believe that good, wholesome family entertainment has been arranged for this year. Anything else I can?
We're just so happy to see a fair
Absolutely.
based on what we've been through the last 18 months. I think
So are we.
everybody's so happy just to see the fair.
I believe that they will be very well pleased with what
And the
we-
weather looks like it's going to be fantastic. So.
Thanks to you, President.
And we'll take credit for that.
Thanks to you, President Hanson, your board, you're going to send us good weather. Thank you.
But no, we're all very happy and excited to see a fair this year. We hope you have a great fair, and I'm sure it will be.
Thank you.
So, absolutely. Thank you.
Thank you very much. Thank you.
So I have a couple public service announcements. Later on the agenda, we're going to do Parks and Recreation got a national accreditation this year, and we'll be recognizing them shortly. This afternoon at 2 o'clock, we'll be at Chesapeake Hills Golf Course for a groundbreaking for the new clubhouse. And lastly, we have two Calvert County youth that were appointed to the Maryland Youth Advisory Council. Mr. Henry Miser of Solomons is a junior at St. Mary's Rankin High School, and he was nominated by the Maryland Association of Student Councils. And we have Emily Shreves of Lusby, is a sophomore at St. Mary's College of Maryland. She was nominated by Association of Local Management Boards. And Emily worked for us last summer as an intern and did an amazing job. So we want to make sure that Emily gets recognized here today. So we certainly want to congratulate those two young individuals for this accomplishment of being recognized for their outstanding leadership in the community. So that's the last thing I have on the public service announcements. We had Dr. Polsky with us today for an update.
Morning, gentlemen.
Good morning.
It's been a little bit since I've joined you, and so happy to provide an update today. I have not been much for making predictions over the course of the last 18 months, given all the unknowns, but I did say back in July that I was predicting an ugly September and October, and so far, unfortunately, that is panning out. So I will point out to everyone at home who's viewing that I was requested to have the slides in a week ago, so the numbers that are up on all the slides are as of last Tuesday. There's not a whole lot of change. I'll point out maybe one or two things that have shifted a little bit since then. As you can see on the slide, that we had the highest number of cases last week ever, with the exception of that peak during the winter prior to the introduction of vaccinations, or at the point where only first responders and healthcare workers were able to access vaccines. So it's a little bit easier to see the numbers there, and you can see, although we had what seems like a little bit of a dip the week of September 2nd, there's a little bit of artifact in there because that was Labor Day week, and almost certainly, and you can see by the numbers of the number of people being tested, that's a reflection of fewer people getting tested during the holiday week, and not that there was an actual decrease in virus transmission. Sorry, this button's a little. There we go. And you can see by age group, so concerning, especially with the start of the school year, is that the positivity rates or the number of cases for both elementary and middle school, which would be that first series of rectangles, and then high school, both of those went up appreciably, keeping in mind that the second set of bars, the 15 to 19-year-olds, there are 3 times fewer individuals in there than in that other. So keep in mind the scale is going to be a little bit different for those two. The only bit of good news is we still continue to see very low numbers of infections in people 75 and over, but we have seen a bit of an increase in cases in the 66 to 75-year-old age range. So taking a look a little bit back in time, I think this is important to get a little bit of perspective. So looking back from the early part of August up until last week, there was a little bit more than a doubling of hospitalizations across the state, and also more than a doubling of intensive care unit admissions. Deaths tripled from the early part of August to the middle of September, and that's one of those areas that we've seen a further increase. So on that slide, it shows 105 deaths across the state for the previous week. The week that just concluded, up to 133 deaths. And while I'm trying to get this to advance, I will also mention that hospitals are filling up. And so both Anne Arundel Medical Center, I may need a new battery in this, both Anne Arundel Medical Center and the largest hospital in the Eastern Shore several weeks ago suspended all non-emergency surgeries because they have so few beds in their hospitals that they're unable to accommodate anyone who should need inpatient care after surgeries. Yes. Sure. There was a situation the previous weekend here where our hospital was unable to transfer someone out for advanced ICU care because there was no hospital in the region that could accept the transfer.
Dr. Polsky, in
Yes, sir.
reference to the hospitals being at capacity, is that the beds at capacity, or is that the staffing that's at capacity?
Those are always linked. So certainly you need a physical space, but then you also need the staff. I can't comment for hospitals outside of our county as to which of the two or whether both were an issue, but that does bring up a good point that, number one, after 18 months, you're seeing more and more burnout, and we know that, at least in some cases, nurses and doctors who would have possibly retired somewhere down the road are taking retirement at an earlier time because they're just completely exhausted. The other is that when you see the numbers that we've all been seeing in the southern part of the country and out in the Mountain West, that those hospitals are absolutely desperate, and so they're paying ridiculous amounts of money for nurses to come and work in these temporary assignments, which means that they're pulling nurses away from other regions of the country. And so this is not a workforce that just has unlimited bounds. That whenever you're working with licensed professionals, you just can't create them out of thin air. And if you're going to pull them in one direction, that means you're pulling them away from another direction. So as we take a look at vaccination, I just want to re-emphasize how well vaccines work. I'm going to talk about boosters in a little bit, but I don't want that to in any way shake people's faith on how well vaccines are working. So again, as of the time that I put this together, 83 out of 84 residents in Calvert who have died from COVID were unvaccinated. And keeping in mind that our vaccination rate for seniors is well over 90%. So if people were not vaccinated, the number of deaths that we would have seen at this point would be well into the hundreds, and possibly, not being no hyperbole, but we may be over 1,000 deaths at this point if it wasn't for vaccinations.
So, Doc, I spoke with a doctor talking about vaccines. So, and maybe this information is widely known out there, but I had not run across it. I said, when I'm talking to mom and dad say, well, you know, it's not okay for my 11-year-old, but it's okay for my 12-year-old. What's the difference? And I don't have an explanation. I'm not a medical professional, but I don't. But talking to a doctor this past week said that the problem is that the amount of dosage is the same given to a 12-year-old as to a 25 or what have you, and that what's being worked on it's still the same type medicine but a lower dosage, and they likened it to like you would give your child children's Tylenol to your thing. Is that accurate?
So I have to preface it by saying that the data for the 5 to 11-year-olds where they have used different doses has not been released publicly, so I have not seen any of that information. So I cannot comment as far as at any lower doses, how that is working relative to what was the standard dose for adolescents and adults. Certainly in some respects, you mentioned things like Tylenol, where an adult dose would be toxic to a child's liver, so
Right.
there's good reason. Part of the factor for vaccines is that the younger you are, the better you respond. So it's not so much that a higher dose would be toxic, it's more the fact that a lower dose is likely to give just as vigorous a response in a child as a larger dose would be in an adult. So we never want to give more of anything than we need to. And so what they were looking at in the trials is what is the optimal dose in children so that they don't end up giving more than necessary, even if there really wasn't a toxicity component.
Okay.
And that age 11, age 12, there has to be a line drawn somewhere, and so that cutoff point is typically when we start to see adolescent changes. And so in some cases, because of hormonal changes and other accelerations in growth, that what would be adequate in that age range above that 11, 12 cutoff may differ from that 5 to 11. They could have at some point drawn it at 10/11 or 12/13. So there's a slight bit of, you have to make a cutoff somewhere. But so to answer your question, 11-year-old versus 12-year-old, in most cases, not a dramatic difference.
Doctor, real quick, on that 83 out of 84 Calvert residents, how many of those were before vaccines were widely available?
I will have to get back to you with a specific number. So you also have to keep in mind that there's been a rolling. It's not like everybody got vaccinated on the same date.
Understood.
And so I can look back. Off the top of my head, I would say roughly just a general sense that it was probably about a 50-50 split
Okay.
from when vaccines became available to the general public, not just first responders and healthcare workers, but when
Gotcha.
it was available more widely.
Thank you.
And what we've certainly seen over the last, especially since Delta has shown up in July, is that the deaths are skewing younger and younger. So of the 5 deaths that we had in Calvert a week ago, we had 3 people who were in their mid-50s or younger. And so although we did occasionally see people in their 40s, 50s, and sometimes even younger going back, with Delta we're seeing that even a little bit more frequently. And then just to, again, to get back to Commissioner Gadway's point, that everyone who ends up getting hospitalized, even if they don't die from the illness, that those are hospital beds and those are resources that are now being diverted that cannot be used for people who have heart attacks, for people who are undergoing cancer treatment, for people who very much need surgery. So we have to think broadly that this is not always just about us, but what happens to us impacts all of our neighbors and our family members. If somebody somewhere can advance that slide and bring me maybe a fresh battery. Thank you. And so I just wanted to talk for a minute, since we're now into the school year, about COVID consequences for children and adolescents. I know that early on there was talk about how COVID wasn't such a big deal in children. So with the original strain of COVID, what we were seeing was that children were about 50% less likely to become infected. There was never a time where children were just immune from COVID, but there was lower incidence. With the Delta variant, we're seeing no differences in transmission among children, adolescents, or adults. And what we have seen nationwide and also right here in the state of Maryland is about 1 in 100 children who are diagnosed with COVID end up with disease severe enough that they need to be hospitalized. About a third of those children need ICU care. And the majority, since roughly 99 out of 100 will not get hospitalized, there are other health concerns. So asthma exacerbations, this is an illness that oftentimes the most obvious feature is cough. That children with underlying asthma, this can trigger weeks or even months of prolonged cough. And prior to COVID, the number one cause for absence from school was asthma exacerbations. So we can't ignore that even relatively mild COVID infections in children with asthma can lead to really significant problems. Also, studies have taken a look at what are being referred to as long-haul symptoms. And the studies have varied a little bit. I've seen estimates over 10% of children and adolescents with long haul. I've seen some as low as 2. The best study I've seen showed 4.4%. So roughly about 1 out of every 20, 25 children will develop symptoms that will drag on for weeks or months. And the most common features are fatigue, difficulty concentrating, and foggy thinking. And when we think about education for our children, all of those factors are going to make it much, much more difficult for them. So if someone can advance the slide.
Sir?
Yeah.
Or, I'm sorry, doctor. In reference to kids, I was really surprised, and I don't want to get off topic, but pneumonia takes more than double the amount of children across the country than COVID has over the last couple years. What can we do about stopping pneumonia as well amongst children?
I'm not sure about those statistics.
It's 956 versus 429.
Okay. Well, I'm not sure how much time we want to spend on other topics, but
Right.
happy to address. So pneumonia can be caused by a wide variety of both bacteria and viruses.
Okay.
There are pneumonia vaccines. There are multiple typical pediatric vaccines that deal with preventing respiratory illness. So first off is make sure that your children are vaccinated against everything that is recommended by the CDC and almost certainly recommended by their pediatrician as well.
Mm-hmm.
And then controlling underlying conditions. So I don't know what, for the figure you mentioned, I don't know what percentage of children have underlying conditions like cystic fibrosis, other conditions that can very much predispose. So the second is making sure that for any children who have chronic underlying conditions, that there's regular follow-up to make sure those long-term conditions are managed.
Thank you.
All right, you're welcome. Again, statistics as of last week, looking at both cases of COVID among students and among quarantines. So for technical purposes, the state and the CDC have defined the word isolation, meaning a child or a staff member who actually has COVID, they need to be isolated from everyone else. And then someone who was a close contact and potentially could become contagious, they become quarantined. And so for isolation for students actually having cases of COVID, you can see 126 as of last week, and that's cumulative. I'm sorry, too many numbers. So 31 cases, that was for that week. And then 126 exclusions or quarantines, so children who were close contacts and needed to be isolated. When you add that up, it constitutes about 1% of the student body across the county. So 99% of students, despite all that's going on with COVID, were able to consistently attend school, and that's pretty much been week to week that we've seen about 1% of students excluded either because they are infected or because they've been a close contact. The vast majority of those cases we are not tracing to a contact in the school. Oftentimes it's household transmission, thank you, or other sources. But we have seen some transmission within schools. So the most current data that we have shows that, and I have 1 in 7 close contacts have tested positive for COVID, so it was about a week ago. The most current is 1 in 10. So our positivity rate for students who have been close contacts in the school and then get tested is about 1 in 10 have actually contracted COVID. Now, I will throw out there that only about 35% of parents have had their children tested if they've been close contacts. So it's limited data. I cannot say that 1 in 10 of all of the exposed children, but of those that have been tested, again, we're picking up about 10% positivity rate.
So what's the current policy, I think you know this, the current policy at the Board of Education for child test positive? What's the proximity criteria for telling a child they have to stay home?
It's within, assuming that there is universal mask wearing, and that's important. So if everyone in the classroom is wearing masks, then anyone within 3 feet of an infected person then needs to quarantine. And that's a statewide, that's not a county-specific criteria.
And then what's the process for that child to come back to school that has not tested positive?
Yes. So if the child stays without symptoms, if a child becomes symptomatic at any point, then they get tested right away. If they remain without symptoms, then they or their parents have the option of having them tested somewhere between day 5 and 7 after the contact. And it has to be a PCR test. If the PCR comes back negative, no infection, and they remain asymptomatic, then they can return 3 days earlier. They can return on day 8 as opposed to returning on day 11 if they are not tested.
And that's if they have no symptoms?
Correct. If, certainly if they're symptomatic, well, first off, and it's a general school rule even way before COVID. If a child is clearly ill, they're not coming into school. And the typical rule, if it's non-COVID, is no fevers for a full 24 hours, and if their symptoms are resolved, then they can go back to class.
But no symptoms, it's 8 days, that's state law, it's 8 days of
Well, so these are
quarantine?
not laws. These are state policies formulated by the Maryland Department of Health and the Maryland State Department of Education. But that is the standard across the state, and those are also the standards through the CDC.
I don't know if you probably don't know the answer to this question, but are these kids available to do the virtual learning from home while they're being quarantined?
Yeah, so I know that the school system is going through some adjustment the first week or two, figuring out how to make sure that children who were excluded had access. To the best of my understanding at this point,
Right.
any child excluded due to COVID exposure, whether it happened in the school or whether it happened outside of the school, then they're able to do virtual learning.
Yeah, because a kid could get exposed, go through that period, come back, and a week later be exposed to another student again.
That's a possibility.
And it could just be, continuing.
Right. So, and I will just point out that for those who are eligible for vaccination, if any vaccinated student is not subject to quarantine. So, everyone in the high school and so about 2/3 of middle school students, if those students were vaccinated, the numbers for exclusions would be 0.
So if they're vaccinated, they don't have to, even if they're exposed, they don't have to be quarantined?
As long as they do not develop any symptoms. So we know there is some potential for breakthrough, but again, extrapolating from other types of vaccines, we know that for children and adolescents, that they mount a much stronger immunity. So the likelihood of a breakthrough case in a child, or in this case adolescent, because it's not the vaccines aren't approved for children yet, but in adolescents, the potential for breakthrough cases is going to be substantially lower. I can't give an exact percentage, but it's going to be lower than it would be for adults.
But I thought if you were vaccinated, you could still get it.
You can. So again, adolescents respond much better to vaccines
Right.
than adults. So it's not a 0 risk, but it's substantially lower. So the determination has been made that because the risk is so low in fully vaccinated, and to be fully vaccinated adolescents, that they can remain in school as long as they are asymptomatic.
And just make sure I got it clear. So if a child is not vaccinated, they've been exposed, they go home, they get tested, they don't have it, no symptoms, they're 8 days. If a child is vaccinated and they've been exposed, they're not excluded at all.
Correct.
Without any kind of testing.
Correct.
I don't understand.
But yet CDC says that both vaccinated and unvaccinated people, regardless of age, can carry and spread the disease.
So I'll state again that no vaccine is 100% protective. That in adolescents, protection with any vaccine is stronger protection than we see in adults.
But the vaccinated person could still carry it and still transmit it,
This is
correct?
always a probability event. Anyone in the school, anyone could potentially be carrying COVID. So what they are trying to balance is what is the risk of that individual compared to the average person in the school? And is that risk high enough to warrant that that person needs to be excluded from the school?
And that's a school policy or a state policy?
That is a
or-
state policy, that is CDC policy, and to the best of my knowledge, every school district in the state of Maryland abides by that policy.
So did you say earlier of the students that have been quarantined from exposure, how many of those have developed COVID?
So of the ones who have been excluded, only a third, 35% of parents have had them tested. There's no way for us to know once a student is home whether they have developed COVID. If a child starts developing a cough 3 days later and the parent chooses not to get them tested, we have no way of knowing that.
Of the
So,
35% that are tested, how many of
so
those children
10
have contracted?
So 10% of them, so it's 208 to be specific, 208 children have been tested, 20 of them have developed COVID.
And
How-
go
Go
ahead.
ahead.
All I was going to say was the oversight piece is probably, I mean, the challenge, right?
Just a bit.
Okay.
Yes.
According to the state website, Maryland State COVID Resource website, the only cases of COVID in Calvert County are at Plum Point Elementary, and that's at 13 cases. How can we work better on getting the data properly?
I'm sorry, I'm not sure what source you're looking at?
The state of Maryland COVID resource graphs, everything else,
Okay.
where you go on and click schools on the Maryland State
All right,
website.
So I have no control, and I will say that for all the good work that is being done at the state level, looking at county-specific data regardless, maybe with very, very few exceptions, is not reliable.
So whose data is not reliable, the counties or the states?
What is typically put on the state site is not going to typically be a reliable source of data. So our health department website has information there. Parents can check. Starting probably tomorrow, there will be school specific. So what we have had up since the beginning of school year is by region of the county, by the and we've done this all the way through. So southern region of the county, central region of the county, and northern region of the county. And then we also break it down by school level. So there's a graph for elementary, there's a graph for middle schools, and there's a graph for high schools. Starting, again, likely tomorrow, there will be a school-by-school breakdown of the number of cases in the past week and the cumulative number of cases since the beginning of the school year. So again, I would advise not going to any state source for that. We're going to have much better data locally.
Having inaccurate or inconsistent data is tough to swallow. For example, because according to the state site in Johns Hopkins, Calvert County has had 5,117 total cases of COVID since all this started 561 days ago, but yet your site shows almost over a 50% increase in that at 8,290 cases.
So there are methodological challenges, I'll put it that way. The state only defines a case if there is a PCR confirmation. That's not how things work in the real world. So if any one of us here is symptomatic and we go to our doctor or urgent care, there's a very good chance they're going to do a rapid. And if the rapid is positive and somebody's symptomatic, there is about a 99% chance that that person has COVID. They don't do a PCR, so the state does not count that person. The state undercounts not only in Calvert County, but they undercount all across the state. I talk to my colleagues and have been talking to my colleagues all the way through this. There's a general frustration, but that is the way that the state counts things.
So
again,
one thing that I recall that we learned at the beginning is if somebody was in the Calvert Hospital and had COVID, but they lived in St. Mary's County, that counted as St. Mary's County, right?
They count by county of residence.
Right.
And with deaths, that is particularly problematic because it's not even where that person lives, it's what the family puts on the death certificate.
Right.
And we've had multiple cases where people have lived in nursing homes outside of our county for years,
Yes.
and the county, the family puts a Calvert address on, and so
Right.
the state counts that as a Calvert death, even though the person contracted COVID outside of our county,
Right.
went to a hospital outside of our county, and died outside
Which
of our
creates inaccurate information also.
Right. And,
Right.
and again, for all of these things, myself and many of my colleagues have voiced our concerns about the interpretation of the information out there by the general public and how that can sometimes be misleading. But ultimately, I have no control over how the state presents its data.
Well, somebody's
Doc-
got to send them the data. That's all I was wondering.
And Doc, I'm not attacking you. So to talk to mom and dad, and that's really the most important people in this when because our kids. This is why you get out of bed. I mean, if you got children and they're not your top priority, there's a problem. It seems like there's a huge disconnect because, and I'm not saying you. I'm just saying it seems like the system has absolutes. Get the vaccine, right? Absolute, get the vaccine. But then like the discussion we just had about between 11 and 12. To get the vaccine, but you can still transmit it, but you don't have to go home. But don't trust data on this side. You know what I mean? There's all this, trust me, but don't trust them. I think that at the end of the day, all they're looking for, just hit me with the truth as they know it today. Just give me the best available information. But if you say don't trust that site, boy, that's pretty upsetting. I mean, that's pretty disturbing. What does mom and dad do? Who do they trust?
Commissioner Hart, again, and you can go back through this whole 18 months. I defy anyone to find anything that we have talked about or our health department has provided that has not been the best available information. I have no control over what happens outside of my agency, but if people want the best information for what's happening in Calvert County, then our health department is the best place to find it.
Dr. Polsky, a few weeks ago, I called your department, your office, and I said, hey, I need to find out where I can find the J&J vaccine. And your department, the lady there was very polite, very nice. She was very apologetic even. And the fact that, I'm sorry, sir, we don't keep that data. We don't have access to that data. And I said, okay, well, out of all the billions of dollars that have been put into this, if somebody wants to get a J&J, how do they go about doing that? And your department had the exact same response as the state, so I'll give kudos there. You guys and them were in direct alignment. They said, hop online, Google pharmacies near me, and just start making phone calls and ask them if they got the J&J. That was the solution that I had to go back to the person that was asking the question with. That neither the county nor the state had any records or data on where vaccines were available, specific vaccines were available. Which was, that was pretty disheartening. It was disappointing and disheartening.
So Johnson & Johnson vaccine manufacturing completely halted in late spring or early summer. Neither we nor any state agency across Maryland has had any Johnson & Johnson until this week. We got our first small shipment in. Anyone who may have still had Johnson & Johnson, it had been sitting on their shelves for months, and there is no state database. I'm not trying to make excuses. We have very limited staff. For us to be able to run down every question is just not realistic. That means that we are taking time away from other things that need to be done. Personally, I will say I don't think it's unreasonable for someone to call a couple different pharmacies. But you all, it's important for everyone to keep in mind that public health has been neglected for decades, that we don't have enough staff to do our normal non-COVID on any given week. We have people that have been doing truly yeoman's work for over 18 months now. And every time that we take on a new responsibility, that means that we have to stop doing something else that is assisting other residents of our county. So as much as I'm sorry that you couldn't get your answer.
Well, I did. It took me 17 hours of phone calls over the course of 3 days, but I found it.
But there's a reason why there's a limit to how much we can track down for everyone who calls with given problems. At the moment, Johnson & Johnson is available again, but again, we have a limited number of doses. So for people who are interested, they can, if they go on our registration on our website, if they scroll down for the vaccination clinics, they can see where Johnson & Johnson is, and they are welcome to register for a dose. And then hopefully we will continue to get replenished supplies, but again, we have no control over the supply chain.
So, Doctor, recurring theme, and obviously this entire country is having a staffing issue with everything, from a truck driver to a doctor. That's a recurring theme. But there are priorities. So, obviously, health has got to rank, right? Has the state made any provisions, whether about bringing in military doctors or military staffing? I mean, obviously, we can't be the only one with this problem. All 24 jurisdictions must have this. I mean, is there any discussion of trying to get labor from somewhere?
The help just really isn't there. And again, as we talked about earlier, when there's crisis mode, in Tennessee and Louisiana and Florida and Texas, that any and every available, they're going to be pulling over there. That you can't just manufacture new doctors in Maryland overnight.
No, but does our military have those type of resources? I mean, I'm a
So-
small business guy, right? So
Yeah.
to run my business, no matter what I got to do, I will kick every tire, everything outside the box. So just the question is, I'm sure this is a universal state problem
And-
because it's a country problem.
Commissioner Hart, I don't know the answer. I don't know whether the military has, I won't say excess doctors and nurses, but have sufficient to be able to both take care of the military personnel that they have a responsibility for and provide relief or assistance across 50 states in the country. My guess is that that's probably not realistic. But those are questions that I can't answer because I don't have direct contact with the people that can make those kind of decisions.
About a year ago, a little over a year ago, I remember National Guard came to the rescue across the entire country, setting up different locations and everything else. And that was done by simply asking. And the National Guard got mobilized, and they showed up with doctors and nurses and everybody else. But hoping you're in communication with those around in Calvert County, do you work directly with the hospital and the CEO and the president of the hospital and trying to come to resolutions on some of this stuff?
Yes, we're in contact on a very regular basis, multiple times a week.
So when was your last conversation with the president or CEO of the hospital?
So I talked to the chief of nursing yesterday about staffing. We realize that there are a host of issues, that both staffing for testing, staffing for vaccination, staffing for host. So yesterday was the last time. Do I talk directly to Dean Teague every time that we have a staffing issue? No. Oftentimes there are other people in hospital leadership. I talked to the chief of the ER yesterday. So if you're asking, are there continuing discussions between health department and hospital? Yes. And oftentimes those most productive conversations are happening with the people that are most directly overseeing the types of resources that are in question.
Right, but as the senior health officer for this county, you said you don't communicate with Dean.
I didn't say that.
Or
I just said
regularly,
that my
or-
conversations yesterday
Right.
were with the director of nursing and with the chief of the emergency room. And so it's my job to talk to the people who most directly understand the situations we're dealing with and potentially can get the resources to solve the problems.
I'm trying to wrap my head around that because in a wartime environment, the generals talks to the generals, the presidents talk to the presidents. You as the senior person, when was the last conversation you've had with the leader of the hospital?
I can't give you an exact date. And I will say that I don't like military analogies for healthcare.
Would it be safe to say it's been over a year since you spoke to him?
No.
Okay.
In any event, I know we got more slides to roll through and you have an agenda.
So what is the staffing shortage at the hospital?
You need to talk to the hospital directly. What we were talking about was providing for outpatient testing. As far as specifics on different units, again, that's a Calvert Health Medical System question.
Is there a mandate for vaccinations at Calvert Health?
To the best of my understanding at the moment, there is a test out option. All right, so just quickly to move on. So for pediatric hospitals, this is, you may recall from a little while back that, going forward, not backwards. As we get back to the consequences of COVID infections. So as of, again, about a week ago, there were 130 children who had been hospitalized in Maryland since the beginning of August. And the reason I chose this interval is that this is really the start of the Delta wave. And on the slide it says there's one child from Calvert that required hospitalization due to illness. It's now two. Another child this past week had to be hospitalized.
So Dr. Polsky, based on the discussion that just happened, I'm not sure we have much confidence in any state data that you're going to present, and we should focus on Calvert because we know, you say you know what those numbers are, correct?
Correct.
That would be good moving forward.
Fair enough. All right, so vaccination rates, again, as of a week ago, 60% of high school students and of the eligible middle school students, 52.7 over this past week. Some more students have been vaccinated, so we've just crossed the 60% threshold for high school. And then where we rank statewide, so this is relatively unchanged, really over the past several months. And these are numbers, if you can look week by week how many Calvert residents have been vaccinated, and the last 2 weeks that are not on the chart, or last week that's not on the chart, additional 479 this past week. Here's all the big charts with the big numbers. I'm going to just pop through those. And then I did want to mention about booster doses. So the state refers to third doses, which the CDC defines as for people who are severely immunocompromised. They distinguish that from booster doses, which is for the rest of the population, or essentially 98% of the population who are not severely immunocompromised. The state has fused those all together as additional doses. Just wanted to point out that to this point, Calvert has the highest percentage of people receiving that additional dose relative to the other 23 jurisdictions. And so our protocol, yeah, I'm sorry, Commissioner.
Just to confirm what I thought I heard on TV, it's not a good source. Boosters are only for Pfizer.
So the FDA has approved Pfizer doses, Pfizer for boosters at this point. They are currently, I think, in the process of reviewing Moderna. I'm pretty sure Moderna submitted their...
But as of today,
As of today,
you
correct.
can only get a booster if you had a Pfizer vaccination.
As of this moment, the FDA has only approved Pfizer for booster doses.
Now you're turning into a lawyer on me.
I am giving the most precise wording I can.
Bottom line is, you can only get a booster today if you had a Pfizer vaccine.
So our booster protocol is in most ways in keeping with the CDC recommendations. There are some slight variations, and this was developed and during a collaborative discussion with physicians representing all of the practices in Calvert County. We reviewed the data that we have seen locally, which is much more detailed than what is available nationally. And so what we've seen by reviewing the local data is that over a third of the hospitalizations that have happened as far as breakthrough cases since August 1st, since Delta became a problem, have happened between 4 and 5 months after the second dose received. And so the consensus among the doctors in various practices was that waiting until 6 months left actually, and then you add in the people who end up hospitalized between month 4 and 5 and between 5 and 6, would have left over half of the people who ended up hospitalized still vulnerable to infection. The Israeli government set their threshold at 5 months, and so for the moment, what we have locally is that anyone who's at least 4 months since their second dose and is 50 and older is eligible for a booster dose, and that's if they've received either Pfizer or Moderna.
So who approved Moderna boosters?
This is happening, and I would just say that there are practical considerations, and the practical considerations are that these doses have been given out really across the country. The CDC even acknowledged that as they were deliberating, more than 2 million Americans have received booster doses. And so at this point, we have seen both Moderna and Pfizer completely mirroring each other in terms of both effectiveness and safety. Everything from the initial trials back in July of 2020 to their introduction to the general public in December. They've been indistinguishable in almost every respect. And so there is absolutely no reason to think that the data that was submitted by Moderna will show anything different than what was seen by Pfizer. The practical question is, for the 100 million people who receive Moderna, do we leave them vulnerable to infections that could kill them? And certainly we've seen that people who are, at least locally what our data has shown, that people who have had breakthrough infections, there is no difference between Pfizer and Moderna.
So why hadn't CDC or FDA said, go ahead and give Moderna?
All right. So the FDA and Commissioner Hintz, I'm sure you're aware that the FDA has strict federal protocols.
How about the CDC?
And the CDC, that is an interesting question, and I can't speak for the CDC. So
That's why people are so confused and have issues trusting the data.
well, it's not trusting the data. This is a different issue. So the CDC did go ahead and move forward with third doses with a very limited amount of data. And again, the third doses are people who are severely immunocompromised. They took a different tact with booster doses. So that was, as far as I can tell, a judgment call on the CDC's part.
You know, Doc, what's sad is any of us old enough to remember the AIDS debacle. We're no better today, it seems like, than we were back in the 80s. When we weren't testing the blood supply. It was misinformation how you get it. You know, it was all this money put in it. It seemed like we learned nothing as a country, because if you can't trust a state website, I mean, to say even the data is wrong, I get it that things evolve and things change and adapt and all, but if we still can't trust the information on that site, is a really sad state of affairs as a country. When we were faced with that in our time, it's not like, you know, people go back to Spanish flu or polio. Some of us, you know, aren't old enough to remember polio. There's still some folks do, but none of us remember that. You would think that we would have gotten better in delivering a message with the billions of dollars and the millions of promises and all the professionals and all the education in the world, that we should be able to put on there for mom and dad information that they could trust. I mean, I think that's what I'm walking out of here pretty sad with. And you remember the AIDS debacle. I mean, that was a tragedy. What the information that came out of government, and so that's sad.
Commissioner Hart, I will just emphasize that as a physician, with my primary responsibility to the health and safety of the people who work and live in Calvert County, that I am providing the best data possible for our county.
But you would say don't
And-
trust that site, correct? Only trust your site. Is
I'm
that
saying
accurate?
that, so I think there are two issues. One is, for specific data points, who has the most accurate data? And the answer to that is that locally we have the most accurate data. The second is, and this is a more fundamental question, is can people trust the public agencies that serve them? And I would say that regardless of whether it's the CDC or the FDA or our local health department, that all of us are doing the absolute best job that we can under the circumstances that we are working. These are truly unprecedented circumstances that we're dealing with. The FDA has strict protocols that they have to follow. They can't approve things unless they go through a regulatory process.
Which I
There's
agree with that.
long history of physicians using medications off-label once they are approved. That happens on a
I like
daily
things
basis.
tested. I'm a big fan
And-
of.
And
I
so
like to know it works.
as a physician, I felt it was my responsibility to talk to my physician colleagues around the county. If they had felt that the best course of action was to wait for the CDC and follow them in lockstep, then that's what we would have done at our health department. But there was complete consensus across all of the practices that given the evidence that we had an ethical obligation to make these vaccines, these booster vaccines, available to the residents of Calvert County. that by not moving forward, we were leaving people's health and sometimes their lives in jeopardy unnecessarily. So
But are
I
you going
cannot
against
comment.
CDC regulations?
I cannot comment as to the distrust that has been fomented in this country over decades now, but I can say unequivocally that the residents of Calvert County can trust our health department to provide the best advice, and that they should also consult with their personal physician or nurse practitioner to decide what is best for them.
But are you following the CDC guidelines by doing that?
I will say that we are following about 95% of what has been laid out by the CDC, and there are a few things that are slightly different. So
But
the
see, Doc,
CDC,
that gets difficult on that sticking point, and I'm not a doctor, but I will say I'm a big guy of the law is the law. And so if we're going to enforce something over here, you can't not enforce something over there.
these are not laws. So
But we
I-
use that as a basis with everything, right? We say the CDC says this, the CDC says that. So if we're going to trust them for that, you know what I mean? You see the disconnect. So if you say, and if I understand you right, well, the CDC says Pfizer, not Moderna, but then we locally say no, it's okay, use Moderna. Then that means then all the information come from the CDC. We don't listen to. No?
that's a misinterpretation of what we're achieving.
And that's what I'm asking.
So the majority of people in Calvert got Moderna because of just the luck of the draw. What was sent to Calvert County was predominantly Moderna.
And they may come back tomorrow and say it's okay, but you know when you start interpreting.
And Moderna is a newer company. I don't know exactly why they've trailed a little bit, but the reality is that almost every step of the process, Pfizer has been a few weeks to a month ahead of Moderna. I can certainly see the most plausible explanation is that Pfizer has dealt with the FDA for decades. They know every step, they can anticipate everything. So it makes sense that Pfizer has always been a few weeks ahead. At this point, again, we have seen a year and a half, over a year, of completely mirroring efficacy and safety between Moderna and Pfizer. There is no logical reason to think that the Moderna booster will be any less effective or any less safe than was for Pfizer. Of the majority of Calvert County residents who have been vaccinated, they have received Moderna, not by choice, but that was what was available. To hold them back and leave them in jeopardy, and if you think back to the slides I showed early, with the prevalence of virus in this case, that we, and this was when I say we, collectively as physicians in this county, felt that we were leaving people in true harm. And our option was to do what physicians do on a regular basis every day in this country, which is in some cases use certain medications off-label. It should be done carefully and wisely. This was not just some spur-of-the-moment random decision. We reviewed, and I listened to the FDA's, the CDC's discussion that dragged out for hour after hour. The evidence that they reviewed, we reviewed as well. Plus, we had more detailed hospitalization data than they were able to consider. And as a result of a collective decision, and there were no outliers, everyone on that discussion agreed to the protocol that you see up there.
So is the other jurisdictions in the state following the same thing?
This was a Calvert decision, what we felt best. And so the other thing to keep in mind is that there is no compulsion with this. What we are doing is we are extending protection at the option of individuals. Anyone who wants to wait for the FDA to act on Moderna's application and the CDC to come out with recommendations is perfectly able to do that. No one is telling someone that they have to get a Moderna booster. But we know, again, that there are practical consequences of withholding vaccines at this point for people who have gotten their first two. And any preventable hospitalization, any preventable death, that's my job, and certainly my colleagues around the county felt that that was their job as well.
Doctor, months ago, everything was about testing. You made the comment a second ago about it's been a year since the vaccines. I think the vaccines have only been since December of last year, so 8, 9, 10 months. But why is it so hard to get tests in Calvert County? Calvert County is the last 24th out of 24th in the state on testing our citizens.
So this has never been all about testing. In Calvert County, this has all been about behavior and making sure that people aren't unnecessarily exposing their neighbors, their classmates, people in their community and religious congregations to the spread of virus. This is not, again, this is not about testing.
But
This
yet,
is
when
about-
one of,
Commissioner Gadway, if you can give me a moment,
Okay.
please. This is completely about how we treat each other and the respect that we have for each other. So Calvert County, according to the state data, which, again, take it for what
you
it's
said we
worth,
can't trust.
has consistently shown that we are last in the county. Calvert County has the lowest per capita death rate and the lowest per capita hospitalization rate. Those are the two numbers that I care about. It's not how many tests that are done, it's how many people are getting sick and how many people are dying.
But if we could put testing into elderly and parents' homes that have students for rapid tests before they leave to school in the morning or something like that, or leave to go to the grocery store, and be able to catch it early, from everything I've been told, if you catch it early, there's much more and better treatments available to you to limit the life-threatening complications from it.
So this is an extraordinarily complex decision that this is not the proper forum to talk about how you optimize testing with any county, because it touches on a whole host of things. Number one, how many tests are actually available? Number two, who is going to interpret, who's going to record, who's going to contact trace, and then you get into further issues beyond that. So certainly we can have discussions later on, but the subject matter that you're broaching is not a two-sentence answer that is reasonably covered in a setting like this.
Can you answer in 2 sentences why Calvert citizens have to leave the state to go to Fairfax to get a test so they can fly?
I'm not aware of anyone leaving the state to get a test, so I can't answer a question that I'm not sure what the basis of that
Well,
question is.
I know that some of the letters that you've sent out telling parents that they have to get tests in order to have their kids come back to school, when they call up to make appointments, the earliest they can find an appointment for a test is sometimes 5, 6, 7 days
Well,
to try and find a test.
the health department has a testing site on 231, and you don't need an appointment, and you can just show up between 8:30 and 12:30 for ending quarantine for the asymptomatic children who want to get back to school on day 8 instead of day 11, and that information goes out to parents when they are notified that their child has to go into quarantine.
Docs, and I'm not going to beat you to death on this, this CDC and everything else like this, but if somebody does get a booster and it's not FDA approved and something goes south, do their insurance companies back that? I mean, is there any talk to with the parent, with the patient to just, that to make sure that they're okay through this if something does go wrong?
I will get back to medications are used off-label every day. I'm sure I can't be certain for you as an individual, but for most people who are listening to this, at one point or another, they were prescribed a medication that is not FDA indicated for that specific condition. Every medication that is used to halt preterm labor is used off-label. There is not a single medication that is used in the U.S. that actually was FDA approved for preterm labor. And you can go across the board for how medications are approved for one purpose and routinely used for others, because that's the most practical way to take the best care of your patients.
And the only reason I ask is when I was a kid, Dr. V, if he didn't have it in the back room, you didn't have it. Okay? I mean, it was really that basic, but we're in such a litigious society today, and things are so traumatized. I mean, we had a discussion earlier, about medical expenses and bills and stuff, and sometimes that's a complete financial devastation for folks. So I didn't know if there was a discussion out there that if the patient came in, that they were made well aware of, hey, this is not approved and this is potential consequences, or there's none consequences. That's all. I was just inquiring.
I'll just remind the board it's 11:06.
Oh,
Yep.
excuse me, Mr. President.
No,
Oh,
just
we can.
I'm
not do
available
the
all
ground.
day.
friendly reminder.
Dr. Kurt, or Dr. Polsky. I received a letter from a parent that was signed by you that because their child was in a room with another child that tested positive, their children have to quarantine, and it was on state letterhead, really official, and it said to the parents that they must not go to work until the parents are evaluated. Where's the legal authority on that, sir? I mean, a person who you have no idea who it is, you've never examined them, you have no idea what their job entails, but yet you're telling them that they must not, was the words, must not go to work.
So given that I don't know which specific case you're talking about, it's a little
Huntingtown
bit
High
hard.
School letter.
Well, so we have 16,000 students in the county, and of which there are, I don't know, 1,500 in Huntingtown. So I'm not sure the specific circumstances you're talking about. I will say that we do contact tracing, and if we know through contact tracing that means that a nurse is reaching out and contacting the family and going through questionnaires, that if parents were close contacts, that still under MDH guidance, that those parents are supposed to quarantine, just like students are.
Supposed to, not must. I mean, the letter said must not go to work. If the person has a job outside on a sunny day and he's able to go to work without interacting with any other people and he feels fine,
So I
can't he
don't
go
know
to
the
work?
circumstances of this particular letter. It's possible that parent may work in a setting such as a nursing home or other such settings. So I
sir, he
cannot
works
comment.
outside painting windows.
Again, I hear what you're driving at. Just
Okay.
to bring up a letter that I don't have the opportunity to do any background on. I don't know what else to say at the moment.
Your name was at the bottom and signed it. That's why I thought it was from you. Have you given instructions to having windows down on school buses?
I'm sorry.
Have you given instruction or suggestion to have windows down on school buses while kids are being transported?
We had discussions all through the spring and summer that to optimize airflow, that on days where the weather was conducive, to crack the windows about an inch or so that we would minimize the buildup of aerosol. Yes.
All right, if you could reach out to the busing people or whatever, because last week I received calls and video of children having water sheeting through the windows,
When
crying.
the weather is conducive,
Obviously, your message did not get across clearly. It may have went through a state website, I don't know. But can you please reach out to the schools and or school board or school buses to please let them know it's okay to close the windows if it's raining or cold outside? Thank you.
Is that your last slide?
I think so. Oh,
Yep.
Here's how you register. So again, if for anyone who goes on the website, when they click on there for an appointment, they can scroll down, find the vaccine they want. We are providing first vaccines, second vaccines, and boosters. We have our van out at Rollins today. We had at least 100 people already sign up, most for boosters. The van will be at the county fair tomorrow and Saturday, and we will be at Mount Olive Church on Saturday also. And off the top of my head, I don't remember where we're going to be on Thursday and Friday. Anyway, the van's out to hopefully, if people can't get to us or they can't get to their doctor or pharmacy, we can meet them where they are.
As always, if people have interest in getting the vaccination, they should go to the county website and find out.
Absolutely,
Where it's
and again, the majority of primary care physicians are vaccinating, and I will just quickly remind people that we are now in flu season, and part of the discussion to make boosters available at this point is that we know there will be some people who will come in for a COVID booster who may not necessarily go their way for a flu shot, and vice versa. Somebody who will get a flu shot and then they can get their COVID booster at the same time. The FDA has said, and the CDC has said, that you can co-administer flu and COVID. We'll likely have a dual vaccine probably by next flu season. But if somebody wants to get them both on the same day, that is safe to do.
We didn't have any flu last year. We shouldn't have any this year.
I wish that would be the way it was work. And I will throw
I
out there.
heard this kept away the flu. So.
It did, but we had schools closed, and we know that schools are a prime driver of flu, and most people were not at their work site. And I will just point out that very few people were exposed to the flu last year, and for people who did not get a flu vaccine, that means it's at least 2 years since their immune system has seen the flu. Their circulating antibody levels will be next to 0. So for people who have in the past not gotten a flu vaccine, this is a particular year where you want to do that because your immune system is starting from nothing.
All right.
Doctor, I do have one last thing. If the county attorney can hand you a list of questions there, if you can stop and pick those up. These questions were sent over to you 2 or 3 weeks ago through county admin. You acknowledged receipt of them. We were hoping to have the answers back. Could you please see if you can find this data
So I
and,
answered
and
all,
send it send it over to us? I'd appreciate it.
And I
And
answered
in addition
all
to that, what
the
I'd like,
questions
if
that
at
I
all
put
possible,
during the
could you
presentation today.
please look at the possibility of seeing what you could do about a test to stay policy? You're working on that with the county schools. That'd be great if that would be something you'd be willing to work on.
So, Commissioner President, if you'd be so kind as to give me just another minute or two to talk about test to stay. So I know there's been a lot of talk about test to stay. I have been in contact with people at MDH, and at the moment there is 0 data anywhere in the country on test to stay. There is talk within the state, and I'm part of those discussions about pilot programs. So at the moment, that is a work in progress, but I just want everyone to be aware that there is no data at this point from anywhere in the country that shows that test to stay is a successful type of program. If I feel that based on the information that we're seeing, it would be worthwhile for the students and parents of Calvert County, and that's something that we will strongly look at. And again, I am part of the discussions that are happening. We're the only small county in the state that is part of those discussions.
It's amazing.
Thank you, sir.
In what regard, may I ask?
So I just had to have a negative test to fly on a plane where I'm sitting closer than I am to these 5 gentlemen up here, but a student can't test to stay in school. No response, please. We've spent an hour and
Have a
a
good
half.
day, sir.
Have a good day. I'm just venting. Next item on the agenda is public hearing. Hearing number 1, Department of Finance and Budget. Beth?
Good morning again. Beth Richmond,
Morning.
Deputy Director, Finance and Budget. Our public hearing is regarding the passage of the bond sale resolution. Background: the county is planning to issue new bonds in an amount of up to $25,700,000 and refunding bonds up to $3 million. The use is broken into 2 components. The general fund issuance would be $23,168,000. Issuance cost of $102,000 for a total of $23,270,000. The other use is enterprise fund of $2.4 million. Issuance cost of $30,000. So that enterprise issuance would total $2,430,000. The amount of refunding bonds again is $3 million, and that brings the total bond issuance of $28,700,000. Details of the projects are included in the fiscal year 2021 and 2022 budget documents. Discussion. Prior to the issuance of debt, the county is required to hold a public hearing to receive public comment and the board's approval of resolution. The public hearing is scheduled for today. The bonds are general obligation bonds and as such are backed by the full faith and credit of the county. The bond sale is scheduled on or about October 26th. Attached, please find a draft of the resolution for your consideration. The fiscal impact. The county's newly issued debt will increase by $23,270,000. The refunding is projected to save about $124,000. Just to be clear, this debt is for projects already approved by budget adoption. Conclusion recommendation. Staff recommends that after any public comment, the board act to close the record, approve the issuance of up to $28,700,000 in general obligation bonds, and sign the resolution.
Do we have any public comment?
There are no speakers.
And if there's anybody in the room that wishes to comment, there is a sign-up sheet here.
Sounds like the Wizard of Oz from the man from behind the curtain.
No, Mr. President, this has been duly advertised and is in position for the board to close the record and take action if you
I
wish.
think the room needed a laugh.
So, gentlemen, we have no public comment.
Mr. President, I'll make a motion to close the record and approve and adopt the resolution authorizing the sale of bonds.
Second.
I have a motion and a second to close the record, approve and adopt the resolution authorizing the sale of bonds. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries.
Thank you, gentlemen.
Thank
Yes.
you.
Thank you. Next public hearing on the agenda is Department of Public Safety. Barbara Warner.
Good morning, Commissioners.
Morning.
Good morning.
I'm Barbara Warner, grant writer for the Calvert County Department of Public Safety. Today, we are conducting a public hearing for the Assistance to Firefighters Grant Award, Budget Adjustment and Resolution. This is an award of $497,000 in accordance with the terms of the grant agreement. Awarded funds are used to prevent, prepare for, and respond to fires and emergencies in accordance with the grant agreement. This public hearing was duly advertised in the Calvert County newspapers for 2 consecutive weeks before the public hearing and the Calvert County government website as required by Section 5-103C of the code. If you wish to provide comment on the AFG Grant Award public hearing, please sign up using the sign-in sheet located at the front of the hearing room, or you can call 1-888-475-4499 or 1-877-853-5257, and the meeting ID is 899-4188-8251, and press star 9 when the floor is open for public comment on this specific item. Those calling in to speak on the AFG Grant Award must stay on the line and will have an opportunity to press star 9 after the presentation has concluded. Background. On February 18th, 2021, the Department of Public Safety, on behalf of all county volunteer fire, rescue, EMS departments, submitted an application to the Assistance to Firefighters Grant, AFG, through the Department of Homeland Security, DHS, Federal Emergency Management Agency, FEMA. The AFG grant request was to obtain self-contained breathing apparatus, or SCBAs, equipment for the fire departments, and EMS turnout gear for the Prince Frederick Rescue Squad. Discussion. On August 20th, 2021, DHS FEMA approved the application awarding $497,000. The total federal contribution is $451,818.18 with a non-federal fund cost match of $45,181.82. Due to the amount of grant funding involved, the Board of County Commissioners requires a public hearing and resolution for a budget adjustment under Section 5-103 of the Code of Public Local Laws of Calvert County. Notice of the public hearing for September 28th, 2021 was posted in the Southern Maryland News and the Southern Maryland Voice for 2 consecutive weeks before the hearing. Fiscal Impact. Participating volunteer fire rescue EMS department operational funds will provide the non-federal fund cost match. Conclusion and recommendation. The Department of Public Safety requests the BOCC approve budget adjustment 054, adopt the resolution, and close the record.
Any public comment?
No one,
There are no speakers.
Thank you, Wizard.
nor has anyone signed in, Mr. President.
So we have no public comment. Chair would entertain a motion.
Mr. President,
Yes, sir.
I will make a motion to close the record and approve and adopt the resolution approving budget adjustment 054.
Second.
Have a motion and a second to adopt the resolution and approve budget adjustment 054 and close the record. Any discussion on that motion? Hearing none, all those in favor say aye.
Aye.
Opposed, motion carries. Thank you, Barbara.
Thank you, gentlemen.
Thank you.
Thank you.
Next item on the agenda is recognition. First one is Department of Parks and Recreation. Director Nizal. Now for the good stuff.
Good morning, Commissioner. Shannon Nizal, Director of Parks and Recreation. I'm very excited to be able to be in front of you today to have our staff recognized and our entire department recognized for accreditation. So our department has been working tirelessly on this effort for over 3 years, about 4 years now, to become accredited through the National Recreation and Parks Association, CAPRA, or Commission on Accreditation of Parks and Recreation Agencies, which is the only accreditation agency for parks and recreation agencies in the country. So what we have done is we've been tasked to look at 154 best practice standards in the parks and recreation field nationally for parks and recreation agencies. So we were just recently awarded that accreditation by meeting 153 out of 154 of those standards, which we were told by the commissioners for accreditation that this was outstanding for a first-time accreditation. And we know that absolutely when we come to reaccreditation in 5 years, that we'll definitely have 154 out of 154. So what's so special about this is that there are only 193 parks and recreation agencies in the country that have this elite status of being accredited as a parks and recreation agency. And there are only 5 in the state of Maryland. Calvert County is one of them now. So this shows to you, to our citizens, to everybody that visits Calvert County, that we and Parks and Recreation are meeting those best practice standards to make sure that we're providing the best services, the most efficiencies, the most innovation to our residents and providing the best services as possible. And I do have a number of my team behind me that I'm going to invite up here so they can be recognized. We had a committee put together, so come on up, team. We had a committee put together. All the way, all the way. So we had a committee put together, so this group of amazing folks were kind of the leads in gathering the information, writing the narratives, and making sure that we had all of that information together to have a pretty flawless visit with the auditors. So I'm very proud of this group of folks. We also have some folks watching live that weren't able to come this morning too. So just from me to y'all and our entire department, I am so very proud of you, and the work that you do for the citizens of this county is impeccable, and keep doing a great job. We got 5 years to do it again.
Congratulations. Thank you all for your work.
Shannon, I can tell you from somebody who is at the various fields 5 to 6 times a week, it's well deserved. They're very clean. They look outstanding. We have definitely had our financial challenges, but I tell you, with what we've been doing and working and plowing ahead, I mean, I'm proud to sit out there on the weekends, and that's to you guys. So thank you very much.
Yeah, for sure. Thank you. Next item under recognition is Department of Public Works. Director Glow.
Good morning, Commissioners.
Morning.
Good morning.
Okay, if you didn't know it, we're going to tell you that our water and sewer team went to a competition on 2 September at Ocean City, Maryland, as part of the Chesapeake Tri-Association at the Chesapeake Tri-Association Conference, and they essentially took second out of 19 contestants for the taste of the water. The water came from our Solomons area, and those guys that are here today are the guys from the Solomons plant, essentially to be honored for that. They provided a sample of water from Solomons drinking water system and won second place out of 19 contestants. The Chesapeake Water Environment Association is dedicated to improving water quality and protecting the water environment in Delaware, Maryland, and the District of Columbia. We request that, of course, the board would recognize the Division of Water and Sewer for this accomplishment, acknowledge employees James Yoakum, we call him Jimmy, he's here, come on up, Jimmy. Chris Hall, the acting division chief, and Matthew Fox. Others that are not present are also Jesse Evans and Aaron Jr. and Jordan Ridgway. Okay, these guys did a hell of a job, and we have a little plaque to put on the I Love Me wall for the county.
Come on up. Come on up. Yeah.
Congratulations. Congratulations. Good job. Congratulations.
Congratulations, guys.
So apparently the best water's in Solomons.
First district.
Yeah. Yeah. These other guys got to step it up.
We're used to it.
Hey. Take it when you get
There's
it.
a reason it's called first.
Next item on the agenda is appointments. Deputy Administrator Vassallo.
Good morning, Commissioners. We have 3 rounds of appointments this morning. First is the Veterans Affairs Commission. Staff is requesting that the board adopt and pass a motion adopting Brandon Temple as a member representing educators or educational administrators. And following this appointment, we'll have no vacancies.
Move to approve.
Second.
Have a motion and a second that we approve Brandon Temple as the educator member of the Veterans Affairs Commission. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries.
The second round of appointments is for the Calvert County Wellness Committee. And staff is requesting that you adopt and pass a motion to appoint Erica Love.
So moved.
Second.
Have a motion and a second that we appoint Erica Love to the Calvert County Wellness Committee. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries.
The third appointment is for the Animal Shelter Advisory Award. And staff is requesting that the board adopt a motion converting the appointment of Dawn Schonkweiler as a citizen member to that representing the Animal Welfare Organization. And following this appointment, you'll have 2 vacancies that we'll need to convert, one for resident District 2 and one for the veterinarian, and that will come back.
So moved.
Second.
Have a motion and a second that we convert the appointment of Dawn Schonkweiler as a citizen member to that representing an animal welfare organization. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries.
Just a reminder, the other 2 appointments we have this morning will be deferred and brought back. That's it.
Thank you.
Thank you.
Whole business. First item, Department of Planning and Zoning.
Morning.
Morning.
Morning, Director Cook.
Good morning, Commissioners. Mary Beth Cook, Director of Planning and Zoning. I'm back this morning following up on a presentation I did last month regarding the history of density and land preservation. part of that discussion included several text amendments that have happened since 2015, specifically text amendment 1508A and B were done together in tandem. For the Prince Frederick Core area, 8008A increased the maximum density from 14 units per acre to 24 units per acre, only in the Newtown district of Prince Frederick. And I also wanted to note that currently the draft Prince Frederick Town Center Master Plan that is going through the process, currently out for comments, we're going to be reviewing with the Planning Commission in October, includes a proposal to take that back down to 14 units per acre throughout the town, at least the core of the town center. Will be the recommendation of the master plan that would then be changed in the updated Prince Frederick Town Center zoning ordinance.
And when do you propose we'll see that?
The master plan is in the first round of comments. The Planning Commission will be considering those comments in October, depending on how long that takes to go through the chapters and their recommendations. We'll bring back a revised plan to them, and it's at the point where they have a recommended plan that we bring it to the Board of County Commissioners. Then you'll have your opportunity. They'll have a public hearing for that recommended plan before it comes to you. Then you'll have an opportunity to make any changes and have a public hearing, hear public comment, and then adopt. So we're shooting for spring on that, and as soon as we have a good, solid draft, then we can start working on the zoning ordinance. But to date, we haven't started that until we know what we're going to be working with. So late next year, potentially early the following year for the zoning ordinance.
It's a long process.
It is.
Well, and we're going to be discussing various things, but the Prince Frederick Master Plan has never been updated since 1989. Is that correct?
That's correct.
Okay.
Yes. We've done text amendments to the zoning ordinance, but the master plan itself has never
That
been
was your
updated.
first year on the board, wasn't it, Steve?
No. Actually, 1989 was a glorious year.
Oh, Lord. Here we go.
Close to it. Close enough. Yes.
He was a college man then.
Shoot.
It was a glorious year.
We digress.
Yeah, that's okay. Do you want to have further conversation about that, take action on that, or go through everything and then talk further?
I would say take action.
Help me out, buddy. Where do I insert my comments?
Right now, it's pertaining to the first, what we're talking about right now is the first one,
Yes.
TA 15-08, which, she's explained the history, she's explained the discussion that's going on in the town center. If we concur, we could start the process to take an action now. We don't have to wait until next spring or whenever we finally get that plan. Because once we get that plan, there's another process.
Right.
And as she said, it'll be late next, we might get it done before our term is over.
I'd just sooner repeal it.
So if there's an action,
So it's my understanding from what Mary Beth said to us that it's impossible to get that many units with the stormwater management regulations anyway.
With open space, stormwater,
Right,
roads.
so the
yeah.
maximum you're going to get anyway is 14.
Right. I mean, we
Yeah.
see we're at 13.8 or something like that over
Right.
at the other development.
Right.
Well,
So I think it would just ease people's minds when they see that go back to the 14 units.
And the only way to achieve it is to go up.
Correct.
Height.
And there is a height
limitation.
restriction.
Right.
So, Counselor, can we take an action today, or is today just a work session? Just clarify for me, please.
Commissioners, I think the purpose of the work session was to get some direction from the board because there's a whole lot of
Right.
work that still needs to be done.
I think
So-
the sooner we do
Right.
this, the quicker you can get
So
moved on.
today, we would give direction to Director Cook if we wanted to repeal this amendment.
I don't know if that's the right word, but I'm all for repealing that 1508A.
Is that a
Take it
motion?
back to 14.
John, is that?
Is that a motion?
Is that
That's
do
a
you need
motion to
or
give the
consensus,
director's
John?
Yeah.
direction.
Just consensus?
Right.
It's direction that we start the process to repeal it.
Yes.
We
Okay.
can't take action to
Yeah.
actually repeal it without
Gotcha.
a public hearing.
Okay.
Yes.
So we don't need a motion, we just need to make the direction.
Either way,
either way.
If there's consensus of all the board, we don't need a motion.
Okay.
So if there's consensus, the direction to Director Cook is that we want to
Okay, so I know the process for a text amendment. John, in repealing, are we doing the same process? Okay,
Because you're replacing the current text with what was once there, so it's.
okay. So it's going to be 4 to 6 months till we get to the final,
Yeah.
based on state law
There's a
requirements.
process.
There's a process. So,
There
but
is.
we will start that process.
Thank you.
You're welcome. The second one, text amendment 08B, removed the condition from single-family detached dwelling units in only the village district of the Prince Frederick Town Center, which had required at least 50% of the site be reserved for commercial, office, or industrial. So when this happened, we were having a lot of developments being proposed that, say, a residential developer came in and they were going to develop a piece of land, and then they were just going to reserve 50% for commercial, with no intention of building it because they're residential, and vice versa, So most builders are either residential or commercial. So with that requirement, we were kind of getting patchwork, mishmash, and removing that requirement allowed some residential developments to move forward. To note, I had staff research the recent apartment developments in the Village District in Prince Frederick Town Center. Those happened after this text amendment. So had they done their developments before that, they would have had to reserve 50% commercial land.
But if there's interest from the citizens to have mixed-use development, to date, that hasn't happened.
It hasn't, and
So with-
so this wasn't even
Right.
encouraging that. It was just a requirement that if you did whatever amount of land you used, you'd have to have the same amount of land reserved for commercial.
Right. So, it's a recognition that we're a small community. We only have certain developers.
Right.
They either do commercial or they do residential. We don't have anybody that does mixed use.
We don't.
And so far, we've been unable to attract anyone to do a mixed-use project.
That's correct. And that really, I believe, was the intent of this, was to encourage mixed use.
Absolutely.
But they found a way around it.
Right.
Yes.
But the item B here, the 1508B, the only way that they are going to get to a 14 dwelling unit per acre is by utilizing this being negated. In
Not
other words,
necessarily, no. They stand alone.
I understand they stand alone, but when we see what 14 units per acre look like over across the highway, trying to incorporate 50% of that into business or commercial would be a near impossibility. Is that correct?
If they had adjacent land or land,
Okay.
even across the street, they could reserve that.
Oh, I
It's-
got you.
Yeah.
Understood.
Didn't
Okay.
have to be necessarily on the exact parcel.
Any action for this text amendment?
Buddy, what's your thoughts?
Well, it's
Because, intentions and what happens,
Well, and could I?
yeah, absolutely.
sure.
I made a point of 1989 being the last updated version for purpose. There's 7 districts, correct?
In Prince Frederick Town Center, yes.
So if we were to go back to the history of each one of the, and I'm not going to misquote this time, there's 1,735 acres in according to the Prince Frederick Master Plan. Since '89, we have seen the 90s with one school being, where I'm going with this ultimately is that what has transpired in Prince Frederick is a story, okay? The new entry district, for example, there was nothing there in '89.
Correct.
If you were to go back and do an overlay of development through the years, there's patterns that have emerged. And I mean, and I go back to the introduction of the first master plan, and I just indulge me. Successful communities are the result of forethought and careful planning. The quality of life in a town is too important to be left to chance. To be effective, a plan must take into consideration aesthetics as well as economic concerns. It must give the community a vision of what it could be. And this mirrored so much from '83, which was the town center master plan concept. I remember the vision or the image of former Commissioner William Bowen on the front page of the Independent, or maybe it was the Recorder. Marty, you're not helping me, buddy. But anyway, he was spearheading the effort of the Prince Frederick Master Plan at a time when they had gone through the whole town center master plan concept in '83. So it's a living document. It takes iterations, but going back to 15-08B for me, I mean, it would be helpful in future discussions if we move forward with further discussions of an overlay of what was there. I know this particular district is where the old food line was, Weiss now. You know, it's off to the side. It's not right on 4 completely. So that's all.
So, but since '89, there have been tweaks
There have.
to what's happened in Prince Frederick. I don't want
Yes.
anybody to think that we
No.
froze things since '89. There have been tweaks over
There's
the
been
years,
text amendments, sure.
changes. The only thing I would say, Commissioner Hart, is to have a walkable community, you've got to have proximity to businesses. And by not having this requirement, at least what we're seeing so far, is you're just getting residential. All the commercials on Route 4 or Prince Frederick Loop Road, and then you just get residential. Especially with phase 2, you know, I don't know how you create those walkable communities without some kind of a requirement that forces, unless I'm wrong,
No,
Director Cook.
correct.
You know, you're just going to get residential. That's all we seem to get here lately.
Or commercial.
And
One
that,
or the other.
and
yeah.
you know, and that definitely wasn't the intent, and it wasn't kind of the bill of goods that was sold, so to speak. But that's what the product appeared, you know. So all the things that I walked into and that train that's always moving, never resolved, you know. And so now with this going forward, being careful, you know my loathing of apartments. I know we need senior apartments, you know, we're an aging population, but I don't want to do anything that encourages any more apartments. I can tell you that. So that's why I'm walking cautiously here if I seem apprehensive. But to Commissioner Hanson's point, you know, the so-called walking community never happened. Right. So that's where I'm kind of deferring to. You know, it's like laws are put on the books, and then there's a whole team of people figuring out how to work around it. So how to put that solid piece in there, and we don't get slapped again, and somebody's not sitting here 10 years from now going, well, look what was there. Because I can tell you some of this stuff nobody could have seen coming. Unless you, I mean, some of the stuff in 1983, when they put that stuff on the books, they never dreamed there'd be 90,000 people here, number one. They never dreamed we'd go through the building of school every year. And how to protect seniors was the intent, you know, that, I mean, when I first came on was the introduction of the addition of Southern Pines down there. And we were on the right pace, and I thought that's where we were going, and they were filling up just like that, to where now we have what we have today, and I don't like what we have today, so.
Mr.
Yeah.
Director, did 08A and 08B come in at the same time?
They did. And they were, yeah, processed together.
I'm fine with them going out at the same time, too.
Yeah, I know an elderly couple that just had to be put in assistant living, and it's for both of them, it's $12,000 a month. And in 5 years, they will be completely broke. They have to sell their home and everything. So we have to come up with a solution to help the elderly people, because
I-
we're all headed in the same. We're all going to head there.
I
And
like the 50-50.
if we help the seniors, we're only helping ourselves in the future. So
No comments about
Right,
me
right.
my age? I'm shocked.
I think you
You're
can take a
youngest
break
generation.
on this
Yeah,
one,
we're-
you know.
we're lightening up on you.
Good,
Yes.
good?
Yep.
Good?
You know what? For me, I'd like to have a work session on it and go through it for the citizens for transparency.
And we will. We'll bring these as text amendments to change the language
So-
to
So
whatever you
even if
want it to be.
consensus is today to remove it, we're still gonna go through a process.
We are,
Right.
yes.
I'm good.
I can,
So, to your question too, 1508A, just so there were three components to that. That was the 24 units per acre. That was the height, and the third was the increase in the footprint for big box.
And the 50-50. Yeah, there were
And
like
then
four
the
text amendments.
50/50
Yes.
was after. I'm just, for full
But
disclosure.
we're not changing
Yeah.
any of that. Just the units.
Right. And I'm just
Yes.
for,
And there was also setbacks.
Yes.
That were reduced.
and just for the sake of history, that's all.
And the height requirement now is currently 3, 4.
It's a height, not plus a habitable roof, so I want to say
Not
it went
floors.
from 50 to 60. I'm
So
sorry,
that's 4 floors.
yeah, I believe so.
Thank you.
Depends. You could have 4-foot ceilings.
Well, yeah. Good. Daycare or something.
Right.
So we're good.
So we're good with
we'll start
going
with the
back to the
process to remove
50-50.
it, Yes.
Okay,
Start the process.
start the process. We also discussed the sliding scale for TDRs. So this has all of the densities listed on it. I'm going to go to the slide that actually talks about the sliding scale. So originally, 5 TDRs were required for the development of any type of residential dwelling, regardless of the unit type. The sliding scale was adopted in 2015 only in the town centers of Prince Frederick, Lesby, and Solomons, where water and sewer infrastructure exists. And this went through many iterations. We had formed the TDR committee, which was made up of agricultural community, development community, and initially this was based on density. And then it kind of evolved into, well, maybe we'll do it on unit type. That took several iterations, and this is ultimately what got adopted. Last year, Text Amendment 2002 proposed to change the TDR requirements on the sliding scale to include a breakdown of bedrooms to make it more equal. When that text amendment got to the Planning Commission, they voted not to move it forward. We brought it back to the commissioners, and you instructed staff to reconvene the TDR committee to talk about what their opinion would be. And this was one of several recommendations that they made to the board in several meetings this past year. But they chose to support keeping this sliding scale as is. I have staff working on documents about the meetings for which we got to that point, and I'll certainly share those with you when we have them.
And Mary Beth, I definitely welcome, I want to hear all the stakeholders in this. Going back to what I said before, you know, my hope was we were going to be able to get affordable units for retirees on fixed incomes. I didn't see that. And so I'm not fearful of moving the TDRs if that's the fear, because I think the SPARK program's been strengthened, and I think we have the ability to strengthen it even further to take it to the intent of what it's supposed to be. I don't know we can afford this model that we've been seeing going forward, and I don't want to seem like the bad guy in the room, but I do believe that that scale's going to have to be addressed. Now, how that shapes up, I want to hear more from the stockholders, but if their only reservation is to not move TDRs, my 20% is to ease that with the PAR program. Because I don't think the way of life we want to live, you want to see as many apartments as it would take to put a dent in that TDR program, if I'm saying that right. So I would much rather attack it that way. I think it'll be cheaper down the road, and I think it'll protect our way of life a lot better. You know, the problem is in 1983, you know, when the traffic study was to get out to the first artery, it was fine when nobody lived here. But that just doesn't hold water anymore. So that's going to be my take on that. And like I say, it's my 20%, but I would want those stakeholders to be at ease that if they felt this was the only vehicle, I think we could find another vehicle to accomplish that.
And Director Cook, just for those listening, we currently exempt senior housing and low-income housing from TDR requirements
In the town centers.
in the town centers.
Yes.
Correct.
Which is only where this sliding scale is gonna be represented, correct?
Where it currently exists, yes.
Yes.
Right.
Only in 3 of the town
So,
centers.
if we go back and revert this back to the 5 TDRs that were originally required, if we revert back to that, that would not affect, senior and low income.
That's correct. That's a separate
So-
regulation.
That's an easy decision. Thank you.
Any other,
So how would you like this? You want us to go back to the TDR committee and say, have them reconsider?
so
My
if there's,
20% is, you know, if that was the main reasoning why they wanted to leave it like that, back just my 20%, I think the PAR program can be strengthened to a factor to where, you know, we don't have to go down that road to get that accomplished.
And this was one of many recommendations they brought forward to you, and I do believe you had accepted all of them, but that was part of it, the
And that
strengthening of the
baffled me
PAR.
back then that
Right.
that stayed there, so,
Yes.
Maybe you better send us what we, what we, voted on.
because I'm gonna have a hard
So we-
time leaving it as is,
Okay.
just because of the product that we've seen.
so if there's consensus to reconsider this text amendment, then as part of that process, I think what we want to hear why the group made the decision that they made.
Okay,
Please.
we can do that?
Yeah.
And
'Cause
just bring it forward as a work session to talk about that? And then
Yes.
determine what sort of text amendment you want to take forward?
Correct.
Okay.
My 20% is good with that, but I want to add that, you know, real estate is a bundle of legal rights. So is this going to be prospective moving forward? If you have a said project on the books, how
And
are they
haven't
affected?
broken ground yet.
How are they affected by this? I guess that's my
You're
question.
probably gonna have to do moving forward. I mean, obviously, you know, but I think,
Posing the question.
yeah,
Very good
you know,
question.
but I think, down the road, you know, we're going back to when you said 1989, you know, time moves quick, you know, wasn't that long ago, we were in high school and they were making all these decisions, you know?
Buddy said it was a long time ago.
Not for me.
No, but for me and Steve,
so-
we were in high school.
John, just legally, what are the parameters?
So vesting is recognized when something is coming out of the ground that's gotten permits and approvals, but the Board of County Commissioners can adopt grandfathering provisions
Yeah.
that are more generous than the vesting.
And we need to do that, because if somebody's already in the process and they're moving forward, and we shut them down right in the middle of it, it's not right.
So for us, it's a matter of understanding the process for development and figuring out when we believe they're in. You know what
Okay.
I'm saying?
Yes, and we do have levels of vesting of plans in our zoning ordinance, so that could be a suggestion we bring forward if you
And
had preliminary approval by the planning commission or
And I said this
conceptual
before, Mary
approval.
Beth, I don't wanna see this onslaught of racing to planning and zoning. We saw that when, remember when?
Impact fee.
Yeah, the impact fee.
Building
That,
permits.
that is so wrong.
So if you get to that point where you're gonna make a change, then we can look at who's in process and where they are and make some determination about the amount of work they've got into a project and how far they along, instead of, I think I wanna do this, I wanna get in now.
Right.
But if they're already started that process, which is a long process,
It is.
Director Cook will know who's in and who's all of a sudden
You'll know
trying
who's
to.
playing games.
Yes.
Sure.
Yeah, so we can figure that out at that time if we get to a point where we want to make a change.
Okay.
Commissioner Gadaway, I'm sorry, I think
I'm all for, it seems to me like our county got along very well up until 2015, before the sliding scale got implemented. And seeing now what the sliding scale and these other items can bring us, I'm perfectly content with going back to the 5. And I'd like to see what that looks like.
and that'll be a
Right.
part of the discussion.
Right.
Okay. I think we're good.
Thank you.
Okay.
Is that complete?
That's all.
All right.
Thank you.
Thank you.
Thank you.
Next item on the agenda is item number 2, Department of Finance and Budget.
Motion to approve.
We're gonna have to, 1:30.
Morning again, Beth Richmond, Deputy Director of Finance and Budgets. The subject is the American Rescue Plan Act budget adjustment. The background. On March 17th, 2019, Calvert County declared a local state of emergency due to the effects of the coronavirus. The United States Treasury appropriated funds to the state of Maryland in the form of the American Rescue Plan Act, or ARPA. The state of Maryland appropriated these funds to various state and local agencies in an effort to cover any necessary expenditures incurred due to the public health emergency and recovery efforts. On September 14th, 2021, a public hearing was held to accept public comments. The public hearing was advertised in a local paper 2 weeks prior to the public hearing. Discussion. These dollars are significant and should be reflected in our fiscal year 2022 budget. The budget adjustment required a public hearing because it is in excess of $150,000. Fiscal impact. An $8,985,948.50 positive increase to the FY22 county adopted budget. Conclusion recommendation. Staff is returning after the 10-day waiting period for approval of Budget Adjustment 053 and adoption of the resolution to increase the FY22 county budget.
Questions? Chair will entertain a motion.
So moved.
So I have a motion and
Second?
a second to make the budget amendment 053. Any discussion on that motion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you.
Thank you, sirs.
Next is consent. Item 1 under consent is Calvert County Detention Center FY 2022 Edward J. Brine Memorial Justice Assistance Grant. Item 2, Department of Finance and Budget Award Recommendation ITB 2022-014. Item 3, Department of Finance and Budget Award Recommendation ITB 2022-011. Any,
No objection to, approve.
hearing none, the consent agenda will be adopted. Next, under new business, item number 2, Department of Public Works.
Good morning, Commissioners.
Morning.
Morning.
Jared Cosgrove, Deputy Director of Public Works. We're here to discuss the agreement of sale and easements agreement for Dow Road Phase 3. Background: 4 of the properties impacted by this phase of road construction are owned by Southern Maryland Investment LLC, Elmer L. Wood Jr., Elmer L. Wood Jr. et al., and Jamie L. Ward. Another property impacted by this phase of road construction is owned by Karen Taylor. The Department of Public Works had appraisals performed on these respective properties in May of 2019 in order to assess current property valuations. DPW then contacted the affected property owners and negotiated proposal payment amounts for these appraisal valuations for both fee simple and revertible easements areas necessary for road construction. As a result of the updated appraisals, the current agreed upon values for the fee simple areas and revertible areas for all 5 parcels total about $31,000. Negotiations for easement acquisitions for the above referenced properties are completed and property owners have executed a contract of purchase and sale agreement. Discussion. Attached is the owner information regarding the subject properties for the executed agreements of sale. Instruments provided for the revertible slope easement areas, fee simple area takings, and agreements of sale are provided as Exhibit A and B for reference. Fiscal impact. The funding for these acquisitions is available within the project budget. Conclusion recommendation. It is requested that the Board of County Commissioners approve the execution of these agreements and authorize the President to sign the contract of purchase and sale documents on behalf of the Board.
Questions?
I'm glad to see the trains moving.
So moved.
Second.
Have a motion and a second that we authorize the president to sign the original contract of purchase and sale documents on behalf of the board. Any discussion on that motion? Hearing none, all those in favor say aye.
Aye.
Opposed, motion carries.
Thank you,
JR.
thank you for getting that
Good job.
done.
For the public, this has been going on for what, 3, 4, 5 years?
Well,
Since
12 years
1989.
total, right?
1989, right, Steve?
I mean, the project initially started, what, 12 years ago, Steve?
Longer than that.
Longer than that? So, nice
Next
to get
item.
it done.
Next item on the agenda is a presentation by our county attorney.
Morning, Commissioners. John Norris, County Attorney, here to bring you an update on the Police Accountability Board and the Administrative Charging Committee. So waiting for the presentation to load. Thank you. As you recall, Chapter 59 was approved by the Maryland General Assembly, and one of the effects of Chapter 59, of course, it goes into effect July 1 of 22. One of the effects of the Chapter 59 was to eliminate the Law Enforcement Officer Bill of Rights and replace it with an administrative charge, with a Police Accountability Board and Administrative Charging Committee that would do much of the same function that was perceived as the Law Enforcement Officer Bill of Rights and hearing process would be. So the local governing body was to approve and appoint a Police Accountability Board. For full disclosure, there are some sheriffs in the state of Maryland that are now contesting the rights of the Board of County Commissioners to appoint that accountability board, but we're proceeding forward as the local governing body is defined in the public safety article as being the Board of County Commissioners. It could be the county council, but our form of government would be the Board of County Commissioners. So for the Police Accountability Board, the Board of County Commissioners must establish the membership, establish the budget and draft, appoint the chair with relevant experience, and establish the procedures for record keeping. Police Accountability Board is to hold quarterly meetings. They are to work with the heads of law enforcement agencies that work inside the county. They appoint 2 members to the Administrative Charging Committee and 1 member to the trial boards. They receive complaints of police misconduct that have been filed by the public, and they review the outcomes of disciplinary matters that have been referred to the Charging Committee. By December 31, they are to provide a report to the local governing body, which would be the county commissioners, and make recommendations on policies that would improve the police accountability in the county. Administrative Charging Committee is the one that is to be 5 persons. It is the chair or the chair's designee of the Police Accountability Board, 2 members of the citizens appointed by the Police Accountability Board, and 2 members appointed by the county commissioners. Charging Committee's role is to review the findings of law enforcement agencies' investigation, review any body camera footage that may be relevant of a police complaint or a complaint of misconduct by the police, determine whether or not to administratively charge the officer, apply a matrix to determine what the discipline should be, and issue a written opinion that describes in detail its findings, determinations and recommendations, and then that's forwarded to the chief law enforcement officer for that individual, who then may apply a more strict penalty or punishment, but may not apply a lesser punishment. Thank you. Administrative Charging Committee may also request information or action from the law enforcement agency. They may find that allegations against a police officer are unfounded or exonerate the police officer, and record in writing any failure of supervision that caused or contributed to the police officer's misconduct. So you see why the information they feed back to the Police Accountability Board is so important. If charged by the Administrative Charging Committee 15 days after the charge, the chief of the law enforcement agency must offer the discipline that's been charged or that's been recommended or something more strict. The officer may seek a review by a trial board. The Police Accountability Board appoints one member to the Civilian Trial Board, as we mentioned previously. So where we are today is really a question of what does the Police Accountability Board and the Administrative Charging Committee look like? Does it look like the draft that we've taken out to the public? From the feedback we've gotten thus far, which has been minimal, the answer is probably not. We're not getting a lot of feedback. We have this up on the website. We've been through the League of Women Voters presentation, and their discussion panel provided a lot of insights. The president and the vice president joined me for that presentation, as well as the deputy administrator. There were questions raised there that make us have to answer a question whether or not 7 is the right number of members, for instance. Should there be more? Should there be fewer? We have had question, or at least an opportunity for people to leave comments on the website, but I'm not sure that that is being as effective as we need to be. Perhaps we need to roll out some of these questions as a survey, and that's my recommendation, is that we do. Should there be a minimum qualification for members of the Police Accountability Board? We have to recall that the chair must have relevant experience. That's a requirement by state law, and the Board of County Commissioners cannot waive that provision. So what is relevant experience? What does the public think relevant experience is?
You know, John, it's going to be difficult because it doesn't look like, I don't want to say this the wrong way, it's not a fun board. I mean, let's think the whole premise of it is, right? I mean, and, but it's so important that if you're going to put people's lives in their hands, they've got to have a little bit of relevance, you know? I mean, you know, so I think it's going to be difficult. And I don't know the right solution here, but I don't think you're going to, I think you're going to have a hard time getting more, you know? I think what we said, what, 7?
Current draft
That's going to be difficult as well.
Yeah.
And then you know, when somebody leaves, I mean, boy, you're just walking down a road that's just never been done before, and boy.
But the way I understand it, we're gonna end up having to have 7 on one and 7 on another, and that's 14, and that's gonna get tough real quick.
There's only 5 on the charging board, isn't it?
Or 5.
On the, yes, on
Charging,
the
okay.
Administrative Charging Committee, there are only
So we're
5.
still talking
One of
12.
which is the chair of the Police Accountability.
So 11.
Yes.
But that's what this process is about, to start a public comment, get some public feedback on what the board looks like.
Correct.
Size, criteria, you know. It's gonna be challenging, but, you know, in order to do this correctly, because we're gonna have to have buy-in from the public for this to work. So the board felt it was in the best interest to hold some public meetings, give the public an opportunity to interject and move forward.
And we have scheduled that for October 12th at 6 p.m. at the Harriet Elizabeth Brown Interim Center. In advance of that, I would like authorization to roll these questions out, asking about the composition, the terms, what's compensation may need to be offered, if any, are there background checks? Because I haven't done a good job of starting the dialogue. Just giving a place for people to offer their opinions has not resulted in people providing those opinions
But all we can do is offer.
Correct.
We can't force people to participate, but,
Correct.
so we have to do what we can do to make sure the public knows about the process, give them an opportunity. At the end of the day, whatever feedback we get, and we move forward. We have to move forward. We don't have a choice.
We don't have
Right,
a choice.
and if they don't buy in, what's the point? I mean, it's.
Well, we just gotta move forward.
Right, yeah,
Right.
I mean, so yeah, it's imperative. And
But I don't see any issue with the questions. It's,
And one of them is as open-ended as this fourth one. What should we consider when preparing our next draft? Is it appropriate for a person to serve on the charging committee for 5 years before being removed? Or should it be shorter?
it's a long time.
Should
so
they-
the other, I'm not sure you need that question about what the next draft should look like, because your questions are the basis for how you're gonna draft the draft. If you get my drift.
Yes, yes,
You can get your draft to drift.
yes, yes.
Because all these questions are gonna formulate what the board looks like and the makeup, so what do you think you're gonna get out of what should the next draft look like?
I think we're gonna get some feedback that is specific to these questions about number of members, background checks, what their background might need to be or should be. But I also wanted to still have some question that provoked some thought as to what didn't I ask you, but you want to tell me.
Okay, in case you missed them.
Correct. Correct.
I'm good.
Agree.
Yes.
And the meeting is scheduled for October the 12th at 6 o'clock at Harriet Brown on Dares Beach Road.
That is a Tuesday. It is not a commissioner meeting day, but it is
Oh,
the day
good.
after, yes, it is the day after Columbus Day
Yep.
at Harriet Elizabeth Brown at 6 p.m. And we're also going to try and offer it virtually because I have to try and live up to the standards that Jenny Plummer-Welker has put in place.
Room and you hear your name.
Right?
That bar is high.
Is it
I know, isn't it?
Yes.
But she's been a great resource in sharing information and tips and tricks, so we're lucky to have her.
And we should give people every opportunity to participate.
Yes.
And now that we're in that world of
Yep.
virtual, we should do that every time we have any kind of public
Yes.
outreach. So,
Yes.
Agreed.
I think we're good.
Thank you.
Thank you.
Thank you.
Thank you.
Next item on the agenda is a work session, Department of Planning and Zoning, St. Mary's Metropolitan Planning Organization. Director Cook, and we have Jenny Plummer-Welker, the famous Jenny
Very
Plummer-Welker.
famous.
So Jenny, is it raining? I saw you come in with an umbrella.
Just starting.
Is it?
Huh,
I knew they were calling for it.
thank you.
Good morning, Commissioners. Mary Beth Cook, Director of Planning and Zoning.
Good afternoon.
Good afternoon.
Oh, good afternoon.
Yeah.
Wow. Yeah, it sure is. Time flies.
When you're having fun.
And I'll let Jenny introduce herself, and she's going to walk us through and introduce the consultant who's going to give the presentation today.
Good afternoon.
Good afternoon.
Jenny Plummer-Welker, Long Range Planning. I am presenting on behalf of Tamara Blake Wallace, Principal Planner. She is unable to be with the Commissioners this afternoon. Today's work session is on the Calvert County, St. Mary's County Metropolitan Planning Organization Complete Streets Draft Plan. You received the staff memorandum from Tamara dated September 14th in advance of the meeting. And the purpose of today's work session is for the board to receive an overview by county staff and the consultants from Johnson, Miriam, and Thomas, otherwise known as JMT. I'm joined today, at least hopefully, we're a little bit early, so hopefully they're online
They're
with us.
on.
Jennifer Ray, Project Manager for JMT, and Megan Duckett, Design Engineer for JMT. JMT was contracted to perform a complete streets study and plan for the St. Mary's Calvert MPO. Actually, it's Calvert St. Mary's, we go first. The MPO was created through a 2014 agreement between and by the Maryland Department of Transportation and the Board of County Commissioners for Calvert County and the Board of County Commissioners for St. Mary's County. The Calvert County MPO area includes areas of Solomons and Lusby and Lexington Park in California and St. Mary's County. The MPO requested JMT to focus on 11 project areas in the MPO area And we created a community advisory committee for that area, or for this project. The committee included community representatives and including bicycle groups from the two counties, excuse me, and also staff from community resources, economic development, parks and recreation, planning and zoning, and public works. JMT visited each of the locations and then provided recommendations to the advisory committee. JMT met virtually with the advisory committee 4 times, starting earlier this year in April, and has held a number of public workshops and meetings virtually. I would like to give a definition of complete streets. Complete streets is a transportation policy and design approach that requires streets to be planned, designed, operated, and maintained to enable safe and convenient and comfortable travel and access for users of all ages and all abilities, regardless of their mode of transportation. Complete streets allow for safe travel by those walking, bicycling, driving, and riding public transportation. The definition is from Wikipedia, which I accessed online today. Included with your agenda packet is the August 2021 draft of the Calvert St. Mary's MPO Complete Streets Plan. JMT staff collected feedback and comments on the draft plan's proposals, and the public comment period on this draft was open through September 23rd, 2021. The MPO staff, which includes staff from Calvert and St. Mary's counties, will review the comments on the draft and may revise the draft plan before presenting it to the MPO. And the MPO is scheduled to meet in October 2021. Commissioner Williams is our representative on the MPO organization. At this point, I'd like to turn it over to the JMT staff for the presentation. Thank you.
Jen.
Thank you.
Thank you so much. I just want to make sure that everyone is able to hear me.
Sound good.
All right. Well, again, thank you for that introduction, and it is a pleasure to be here, to be able to be here virtually in our new world, as we were just talking about, to be able to present the final draft of our Complete Streets Plan and the Calvert St. Mary's MPO Complete Streets Plan. Next slide. The purpose of this project is to develop a complete streets plan for the Calvert St. Mary's MPO and really ensuring that it can be easily implemented and integrate well with the existing transportation plans. It is not to reinvent the wheel, it is to supplement and add in. And as was noted on some of the comments earlier in the meeting, something that can be implemented easily so that the future does include sidewalks and bicycle connections, and understanding that everybody has a place within the right-of-way and making sure that every mode of transportation can be taken care of. In addition, we looked at 3 context zone concepts and took a look at different treatments that can be applied to each of those specific zones that will allow for safer and more accessible modes of transportation, ensuring that each person, regardless of ability, has the capability to get around through the area. We developed conceptual alternatives for the 11 project locations, really using those as our pilot projects that were identified by the MPO and making sure that they could fit within those respective context zones. Then we identified performance-based measures to ensure that we can measure if these are working in the manner that they are supposed to be working. And though the MPO will be able to use and analyze the effectiveness of the multimodal network provided through the implementation plan. And that implementation plan also will help the MPO prioritize and identify projects that will best enhance the overall network. So we're going to be diving deeper into the Complete Streets Plan components throughout the presentation. Next slide. Through coordination with, is it advancing? There you go. Through coordination with the MPO project team and a group of key community stakeholder representatives that, as you heard Jenny talk about, the CAC, our project team developed that draft of the Complete Streets Plan. We presented it to the general public through those public meetings and then revised it to reflect the feedback from the community. And it was a lot of great feedback from the community and from our CAC members. We incorporated the performance-based measures and implementation plan, and that revised version of the plan has been reviewed by the project team and has been presented to the CAC, and we are gathering the final comments for the final review with the MPO. Go to the next slide. The concept zone concepts that were included in the draft Complete Streets plans are based on MDOT State Highway Administration's context-driven guide, so that everything about this Complete Streets plan fits within the other transportation plans in the area as well as the state's initiatives. It's the context-driven guide is a statewide planning and design resource offering guidelines that help establish the safe and effective multimodal transportation solutions. So that guide focuses on developing transportation facilities based on the context of the surrounding area and suggests design treatments and features to enhance system operation and safety of all users. So it is not just saying that one size fits all, it's looking at the context and making sure that everything fits within that context. MDOT-SHA identified a total of 5 context zones statewide, and those statewide context zones were developed based on the population density, the land use, the primary purpose of travelers throughout the area, among many other features. Just want to note that concept zones are not the same as land use zoning. That was something that we wanted to make sure was clarified early on in the process to help understand that what is on the land use is not necessarily the context. Context is definitely how it feels, and we'll be going into that in more detail. The map on the screen shows that the majority of the Calvert St. Mary's MPO area is within the MDOT-SHA identified suburban context zone, which is shown in gray. So next slide. Because most of the MPO area is within the suburban context zone, the project team created 3 new, more focused context zones within the overall suburban context zone. This is what will allow the Complete Streets plan to identify and accommodate the existing range of roadway contexts within the MPO. These context zones provide more specific guidelines and recommendations, and they can be used to guide future project development within the area, making sure that the guidance is more directed and more specific for this region than simply the larger overarching statewide guide. The map shown here highlights the 3 suburban context zones that were developed by the Plan Suburban, Suburban Arterial, and that's shown in orange. The suburban commercial is shown in blue, and the suburban residential is shown in purple. Similar to the state context zones, these zones have been defined based on the density of development, the adjacent land uses, and the primary purposes of travelers throughout the area. On the next few slides, Megan Duckett, our project engineer, will explain each of these context zones in a little more detail.
Thank you, Jen. I appreciate it. Until the next slide pops up. Thanks, Jenny. So the first context zone that we developed for the MPO, as Jen had mentioned, is the suburban arterial context zone. So roadways within this zone are generally surrounded by low-density land uses and have high levels of vehicle, truck, and transit traffic. They also typically see lower levels of pedestrian and bicycle activity as their primary purpose of users traveling within this road or within this zone is quick point-to-point access. The buildings along these roadways typically don't have direct access off of the roadway, and their target speeds are usually higher. For example, Patuxent Beach Road and Solomon's Island Road are identified as roadways within the suburban aerial context zone. So as you can see in the typical section shown on this slide, vehicles in transit generally share the roadway space within this context zone, and they have an option to have a dedicated transit lane as well. Separated shared use facilities for bicycles and pedestrians are recommended when needed. However, on-road bike facilities are not recommended in this context zone due to those higher target speeds on these roadways. On the next slide, we'll talk about the suburban commercial context zone. So roadways within this zone typically reflect areas with land use that is medium to high density, commercial or mixed use. And these areas have moderate to frequent transit activity to service shops, restaurants, and businesses along the roadway. And because of the commercial activity in these areas, these roadways typically see high levels of pedestrian and bicycle traffic. And the businesses and roadways along these, businesses and buildings along these roadways generally have direct access from the roadway using commercial driveway entrances. So roads that are examples of this context zone are Three Notch Road, Great Mills Road, and H.G. Truman. So roads within the suburban or commercial zone, as you can see in the typical section shown here, have narrower minimum lane road widths and lower target speeds than the suburban arterial zone. Bike facilities can also be on-road or can be directed onto a separated shared use path for bikes and pedestrians on one side of the road. And sidewalks are also recommended on either both sides of the road or on only one side if a shared use path is present. On the next slide, we can talk about our last context zone, which is the suburban residential context zone. And this covers much of the MPO area. So some examples of roadways in this zone are the Wildwood Parkway and Dow Road. And these roadways are surrounded by more residential and rural land uses. So they see lower levels of truck traffic, bicycle, and pedestrian activity on these roads. And because transit activity is lower on these roadways, dedicated transit lanes are not recommended within the zone, and the transit and vehicles typically share the same lanes. Bikes are also recommended to utilize on-road facilities through either a shared street facility or a dedicated bike lane. And if possible, a shared use path can also be implemented to accommodate bicycles as well as sidewalks on either both or one side of the roadway. On the next slide, so I'll talk about the design elements and treatments for these context zones. So these zones provide the basis for determining recommended design elements and treatments for transportation projects within the MPO. The Complete Streets Plan identifies a variety of potential elements which have been separated by user type, which are roadway, pedestrian, bicycle, and transit. So the chart on this slide and the following slide can be used to determine which elements are recommended, optional, or not recommended for transportation projects in each of those three suburban context zones that we discussed. So for example, if you're looking at this matrix here, if you're looking at a transportation project within the suburban commercial context zone, you can see under the roadway category that we would consider roundabouts at intersections for a suburban commercial context zone, but speed humps would not be recommended. And then for pedestrian elements, ADA compliant sidewalks and curb ramps are recommended, and we could also consider adding curb extensions or bulb outs as well. On the next slide, we have the second half of this matrix that's within our Complete Streets Plan, and this half provides the elements for bicycles and transit. So for example here, for that suburban commercial zone, a shared street facility would not be recommended, but a dedicated on-road facility like a bike lane would be an option for that context zone. On the next slide, we'll dive into those 11 identified projects that the Calvert St. Mary's MPO had identified for JMT to dive into and evaluate as potential projects for the MPO. So this map here shows each of the 11 project locations and extents for your reference. So we developed multimodal alternatives to reflect the project location's specific context zones and the design treatments that are recommended within that zone. So there are 6 projects located within Calvert County. So in the interest of time, I'll give a brief summary of the Calvert County projects now. And if you have additional questions on these alternatives, we can of course go into more detail. But to start, I'll talk about the Cove Point Park Trail project, which is a project that will improve the Cove Point Park master plan concept to include complete streets ideas and elements which will improve the multimodal network within the park and connecting to the park along Cove Point Road. The Appeal Lane Sidewalks project intends to implement sidewalks along Appeal Lane, which will provide a pedestrian connection between those nearby community centers, the senior housing facilities on that roadway, the elementary schools, and to also connect those facilities with the shopping center across H.G. Truman Road. The Lusby Parkway project, shown in that light pink color at the top of the map, that is a proposed new roadway running parallel to H.G. Truman Road with multimodal accommodations along it, which will aim to reduce congestion along H.G. Truman Road through that area with multiple shopping centers. Dal Road Sidewalk Extension, that is a project to complete the bike lanes and sidewalk improvements along Dal Road to the end of the public right-of-way, which will fully connect the residences along that roadway out to H.G. Truman Road. Patuxent Parkway crosswalks will provide a pedestrian and bicycle crossing of Solomon's Island Road at the Patuxent Point Parkway, which will serve as a bike and ped connection between the residences on the west side of Solomon's Island Road and the shopping center on the east side. And lastly, for Calvert County, Solomon's Island Sidewalk Project will fill the sidewalk gaps along the boardwalk area of Solomon's Island Road and provide a complete pedestrian connection along the restaurants and businesses in that area. We also have 5 projects within St. Mary's County that were part of this Complete Streets Plan, which include the St. Mary's Park Bike and Trail Routes Project, the 3-Notch Trail and Linkages Project, the FDR Boulevard and Shangri-La Project, the Tulagi Place and NASPAX Project, and lastly, the Great Mills Corridor Project. On the next slide, we can talk about the prioritization of all of these projects we discussed within the Complete Streets Plan. So we analyzed these 11 identified project locations to determine their priority ranking for the MPO. So to rank these projects, high-level cost estimates were developed for the construction of these projects. Next, we determined the estimated time frame for the coordination, design, and construction of each of these projects, as you can see in this table here. And then we analyzed the level of impact that each of these projects would have on the surrounding community and the multimodal network overall. So then we ranked these projects from very high to average community impact. So any project that had high or very high community impact with a short-term time frame to implement was ranked as one of the top priority projects for the MPO. Because these short-term projects typically had lower costs associated as well. And these top priority projects will provide a large benefit to the community over a short period of time, and as I mentioned, a low cost for the MPO. Next in the ranking were ones that had high or very high community impact over a medium or long-term time frame with average costs associated with those projects. So these projects still provide a great community impact, but will cost more and slightly longer to implement for the MPO. And lastly, the projects that had average community impact were ranked as the lower priority projects, as they will tend to provide slightly less community value than those other projects. Of course, they'll still provide value, but we want to make sure we're prioritizing higher community value with low cost and low time frame to implement for the MPO. On the next slide, I want to discuss the future project recommendations. So the implementation plan also includes a section where we discuss what the projects that are recommended for the MPO to consider over the next several years are. So the future project recommendations were established through a variety of ways. At the start of this project, we did perform a dashboard review of the available GIS data, and as Jenny mentioned, performed an in-person field visit to identify those multimodal network gaps within the MPO. And through this investigation, we identified several future project recommendations that we felt would enhance the network. And many of these future project recommendations were also highlighted through the discussions with the CAC members and during the public workshops and meetings as potential recommendations for the project team to consider. So the projects recommended by the community members were considered and analyzed by the project team and added to the list of recommendations within the plan if the projects would align with the respective context zone and complete street guidelines that had been developed for the plan. On the next slide, so we also developed several performance-based measures the MPO staff can use to analyze the state of the MPO's multimodal network as it continues to be developed. These measures include considering the miles of sidewalk and bike facilities to analyze their ped and bike facilities within the area, as well as monitoring the number of people using transit services to consider the transit ridership levels within the community. It's very important for the MPO to continuously monitor the state of their multimodal network, to ensure a more safe and efficient system for the community. So on the next slide, talk about the policy recommendations that are included within the Complete Streets Plan. So the MPO does not currently have a Complete Streets policy in place. Therefore, within the Complete Streets Plan, we recommend that the MPO either formally adopt the M.SHA Complete Streets policy or develop a supplemental policy that will incorporate additional MPO-specific policies. So within the implementation plan, we identified several policy recommendations that the MPO could consider as supplemental policies to incorporate when developing or adopting a Complete Streets policy. So as you can see on the screen, these recommendations include policies like providing grass buffers between curbs and shared use paths or sidewalks where possible, also identifying public, vehicular, and bicycle parking areas near trails or bike projects. We feel that these policies will ensure that the Complete Street considerations continue to be included in future projects within the MPO moving forward. So with that, I'll turn it back over to we'll go to the next slide and we can answer any questions anyone has on anything that was presented.
I know as I was trying to read this last night and over the weekend, trying to process it, the only thing I got to say is thank you very much for explaining it the way you did, because it all makes sense now.
I'm very happy to hear that.
Any questions?
Yes, it certainly is. It's a lot of information and a lot of different components went into it, just making sure that we weren't taking simply statewide policies and plans and trying to shoehorn them in, that this was very specific for the region and the densities that are here between the contact zones, as well as the implementation and prioritization plans, and of course the policy recommendations to help just codify a little bit further that Complete Streets becomes incorporated throughout the region in those policies.
Okay,
Thank you.
Thank you.
thank you.
Staff recommends that you review it, and then that you recommend that the Calvert St. Mary's MPO adopt the Complete Streets Plan. As I mentioned, Commissioner Williams is currently the representative on the MPO for our county.
And by adopting the plan, what does that actually mean in real life?
It means that as we move forward, we would consider these policies as the county does either work on sidewalks, bicycles, transit, so it would be used as policy recommendations for Calvert County Planning and Zoning, Public Works Department, and Community Resources with the public transit. I don't believe, and John Norris can correct me, that it holds the county to anything as policy recommendations. It would be through implementation, through capital improvements program, or like the Lusby or Solomon's master plan and zoning ordinances, that it would actually be implemented.
So it's, go ahead.
No, go ahead.
It's more about guidance as you plan work and activities in those areas. Retrofitting sidewalks, new construction, make sure you're putting in the sidewalks and the bike trails and.
Yes.
Okay.
It also.
Go ahead, Jenny.
It also provides guidance when we look at capital improvement projects, what the priority might be based upon their analysis. You might note there, I believe the crosswalk across Maryland 4 ranked a bit higher than, I forget what the 11th project was, but it was one of our projects.
Cove Point Park.
Thank you, Cove Point Park. Yes. So it gives some guidance on
Right.
CIP priority.
So there's a development project in the plans for Lusby. So we would make sure that we incorporate these recommendations in the design of roads that have to be built to accommodate that project, or for his entrance and egress you know, make sure that we incorporate sidewalks and whatever's recommended for that road, correct?
Yes, but it's a multi-step process. This is the policy recommendations, and then we would need to implement them through zoning, and through that way.
So are there recommendations in this report that we currently don't address?
That's a good question, and I am not able to answer that at this moment. I'm not prepared to answer that question.
Because I know in the town centers, we're requiring sidewalks. I don't know about bike trails and those kinds of things, but a lot of the things I saw in here, I thought, well, we should already be requiring those in the town centers anyway. But I guess this plan just provides extra guidance in case we miss something.
Yes, for example, when the Solomon's Town Center Master Plan was updated and adopted in 2009, we included a map of potential future bikeways and also potential future sidewalks. And Department of Public Works has been working through either county funds or state funds to implement, to fill in those gaps.
Correct. Because the state highway has done some projects to put in sidewalks and
Yes.
streetlights and things like that.
Yeah, because like at Dunkirk Park, there's nowhere to walk but in the road.
Yeah.
So you got people walking on both sides of the road and cars coming in both directions.
Right.
Yes. One of the things we would like is, this is for the MPO area, so that's Solomons and Lusby area. We would like to take some of the key points from this plan and look at implementing that either in the other town centers or in the county where it's appropriate.
So now that Dunkirk Park is going to be in the town center, correct?
It will eventually be, you need to actually do a map amendment to the Dunkirk Town Center, but yes, the
Will that
intent is to
open
bring
up
it in.
any additional funding from the state? Because it was my understanding that if the park was incorporated into the town center, there was additional funding that you could possibly get in grants.
So with the Dunkirk Town Center, with the future expansion, that will allow us to go to the state and request that the Dunkirk Priority Funding area be expanded. And there are incentives for being a PFA.
Right.
One of them is for the state highway, is that for projects located in a priority funding area, I believe the state will fund 100% of the sidewalk retrofit. However, if it's outside of PFA, the state would only fund 50% and the local jurisdiction would be responsible for the other 50%.
Right. How do you get an area to be incorporated into priority funding?
There, it was a state legislation adopted in 1997, I think. And so the county initially set forth our priority funding areas. There is a formal process to request the state. It's a letter to the Maryland Department of Planning Secretary requesting that the area be expanded. And there's certain thresholds that the area must meet.
So that was going to be my next question. Just like the last plan wasn't done until 1989, when will that be updated as far as the priority funding areas? Do they ever expand them?
Yes.
Open up new opportunities?
So a few years ago, probably about 2016 or so, we worked with the state and requested that a portion of Maryland 2-4 along Prince Frederick that had not previously been included in the PFA, that be expanded so that then we would be eligible for state funding. Also, Chesapeake Beach was interested in expanding the PFA to include Route Maryland 260 so that they would qualify for like sidewalk funding from the
Okay.
state. So yes, it is possible, and we have done it in the past.
Great, thank you.
Really quick, analogous to your point with this specific metropolitan planning organization, it's a census-driven designated area, just globally, so that everybody understands. This is, when this arrived, if you look at the map, strategically, the center of it is the bridge, and it was never stated expressly that it was never told to anyone that it would be very helpful for the bridge construction to be in an MPO. That's what I'm trying to say. So in essence, Kelly, this is just a designated area that, you know, if an entity wants to apply, it's a check the box, in other words, for grants and projects specific to the MPO.
Another advantage is that funding goes directly to the MPO and doesn't necessarily pass. We don't have to compete
Right.
with other jurisdictions for MPO funds. So that is another advantage.
Should
Yeah,
have
I know it
added a
allows-
12th project. Replace the bridge.
I know it allows businesses to get
With
loans
bicycle
at
access.
lower rates and stuff like that too, right?
The priority funding area is a minimum threshold for a Sustainable Communities designation. And through the Sustainable Communities designation, there are certain grants and loans that are available through the Maryland Department of HDC,
Right.
Housing and Community Development, or Department of Commerce. And then Kelly Slagle with Economic Development is certainly aware of those.
Good.
Thank you, Jen.
Any
Thank
other
you.
questions?
Thank you.
Thank you.
I think we're
Thanks
good.
to
Thank
DOT
you.
staff.
Thank you, ladies.
Thank you.
Thank
Thank
you.
you very much.
Have a great afternoon.
You too.
Next item on the agenda is public comment. We have nobody with us, but
Commissioner,
Yeah, I
there-
was wondering about if it's possible to make a recommendation to
adopt.
recommend that
I'm
the
sorry.
MPO adopt the draft plan.
I just thought you were doing public comment.
You just need a
John, is it
consensus.
permissible for me to make a motion, or should
Yep.
I abstain?
Absolutely.
You the motion, man.
MPO?
It truly is no conflict. You're the Board of County Commissioners representative for the MPO.
All
so
right.
It's not a
If none
conflict.
being heard, so moved.
Second.
so I have a motion and a second that we adopt the Complete Streets Plan by the Calvert St. Mary's Metropolitan Planning Organization. Any discussion on that motion?
May I refine? You're not adopting, you're recommending for adoption.
Recommending adoption of the Complete Streets Plan by the Calvert
think
St.
you need to
Mary's
switch
Metropolitan
seats is
Planning
what you need to do.
Organization. Hey,
Thank you for your sagacity.
Ooh, there it is.
20, that's
There it is. That's a good one
John,
right
give
there.
me the dictionary.
I haven't heard that one.
Nope.
7
And-
years. Ooh,
I
you
don't
pulled
know.
one from the vault.
I believe there's a motion on the floor.
I'm trying. Any discussion on the motion? Hearing none, all those in favor say aye.
Aye.
Opposed, motion carries. Thank you, ladies.
Thank you.
Thank you.
Now, is there any public comment?
It's been a while, Steve.
President, we've been advised there is no one on the line. And there's
Excellent.
Marty's in the room.
Next item on the agenda is Commissioner reports. Commissioner Gadway.
I knew you were going to start with me, and I didn't know that I was going to be ready. On Saturday the 19th, I had the pleasure of going down to the Waterman's Festival in Solomons. I want to give a huge thanks to Rachel and Jason Dean, the sponsor, or the people who put on the event, all those sponsors. It was a huge success. Dina Dove sang the national anthem, and it was even commented and noted by most everyone there that an eagle flew right over the top of the harbor during that period.
Jeez.
And it was shocking. It was extremely pleasantly surprising to see every single boat in the entire harbor, including an 80-foot yacht, came to an immediate stop, and everybody came out on deck to recognize the national anthem. There was hundreds of attendants down there, dozens of boats moored and anchored. They ran out of shirts, canned beverages. It was huge trophies to all. The facilities were perfect. They commended Public Works for all the work that had done in order to get the stuff together down there. They thanked the commissioners multiple times. And at one point in time, I was invited to go out on the Captain's Lady, captained by Junior Abel out of Lusby. He's homeschooled at 12 years old. And he took a 40-some foot, 10-foot wide workboat and docked it incredibly fast. And the sad part is, in 5 years when he goes to get his license, MVA is going to make him try and parallel park a car. So maybe they need to take him out on the.
What's
needs to
even
take them
more
out on the boat.
amazing, though, he can't take that boat out by himself.
Gotcha.
Now, he can do that and probably better than 99% of the people in the
Right.
water, when I was a kid, you'd have to go through all that, but it's got to be, I think once you break, what is it, 12 feet or something? 16 years old. That is
Well,
crazy.
With that being said, Junior, if you're watching, or hopefully you'll see something, kudos to you and thank you for letting me ride on the boat that day. I had a great time. Additionally, Shannon Murphy, I want to commend her on her 37 years of VA service, Veterans Administration. She's the outgoing director of Charlotte Hall Veterans Home. Can't say enough about her. Had the honor of attending her 37-year retirement. And congratulations to Edward Jones in Dunkirk for the ribbon cutting I did last week. Thank you, sir.
Thank you. Commissioner Hart?
Me, Commissioner Gadway, and Commissioner Hance were at the Marine Museum. It had been 2 years since they had a chance to, because of COVID, to hand out the volunteer awards. It was amazing. They did a great job. I was down Art Fest for award ceremony down there. And on a very, very sad note, lost a friend. Calvert County lost a great friend. And David Barrett, he was a good, great man, great family man, great friend. If you didn't know him, you really missed out. So just wanted to send my condolences out again to his family. Very great people. So.
Commissioner McConkey?
Yeah, I also attended the funeral for David. I didn't know him very well, but I know Bonnie very well, and I did a very large tree right beside their house, and he watched every move I made the whole time that I did it.
Oh, he's awesome.
So it was very sad for that. I also attended Bill Goddard's funeral, Calvert County resident, very well known, used to be a Prince George's County firefighter, and the past president of the Howard County Fire Service. Great guy, big loss. Seems like I attend more funerals than anything anymore. I also attended the Southern Maryland Community Network event down at No Time to Cook. It was a very, very good event. Great nonprofit that does a lot of good things for people in his community. I knew him back when I was on the United Way board, and thank you to Jen for inviting me to it. And that's about it. We're going down to the groundbreaking of the golf course clubhouse today, which is going to be really nice. So hope to see everyone there.
Commissioner Weems?
Yes, sir, Mr. President. I too want to extend my condolences to the Barrett family and also to the Andrews family, Mari Andrews. This morning, I was told she passed. So she was a resident of Asbury, really a nice lady, and she'll be missed as well. I want to congratulate Katie Souza on her Girl Scout Gold Award. I had the honor of attending that this past Saturday, and she built a labyrinth park. And in essence, it's a structure at St. Paul's, and one of the aldermen told me to make sure that our staff here at the courthouse, as well as all court personnel, if they get a chance, go check it out. It's a soothing area. Why walk the labyrinth? The winding path may be used as a metaphor for one's own spiritual journey, or to quiet, restore, heal, center, and deepen one's relationship to self. And that is part of Labyrinth Park. Sunday, I had the pleasure of taking part in the crowning of Kobe Valentine as Lord Calvert, and Gabrielle Fox. She's our new Miss Tranquility 2021. And I just want to congratulate those young people. And that's all I have.
Thank you. So last week I attended the Marine Museum Volunteer Appreciation Dinner, and I had no idea the amount of volunteers that work at Calvert Marine Museum, over 500 volunteers. And they recognized them for their hours served. And there were individuals there that work every day, 5 days a week as volunteers. and don't miss a day. It was quite an event, and to see that kind of volunteerism, I shouldn't be surprised in Calvert County, but I was. It was quite interesting to see. Just remind everybody that fair starts on Wednesday night on 2/31, Wednesday through Sunday. So get some time, go out to visit the fair. On October the 12th, we're going to have a meeting at the Harriet Brown Center on Dares Beach Road for the Police Accountability Board. We're looking for public participation to help draft up those boards. And I guess that's all I have for today. And as Commissioner McConkey mentioned, we're going to do the groundbreaking for the new golf course clubhouse this afternoon. And on Thursday evening, we'll be at Dunkirk Park dedicating the new playground equipment. So I think that's at 6 o'clock on Thursday evening. So other than that, that's all I have. Commissioner Weems, you have a motion for me?
I'd like to make a motion to adjourn.
Second.
Don't we have executive session? Nope, no executive session today. Thank you. Okay, have a motion and a second to adjourn. All those in favor say aye.
Aye.
Opposed, motion carries. Everyone have a great day.
All right.